I call this to order today, the House Oversight Committee meeting. Thank you all for being here. First, I'd like to recognize our Sergeant at Arms. When I call your name, if you could just wave to the crowd, let everybody know who you are. Jonas Cherry, Michael Galloway, David Little, and Stafford Young. Thank you guys for being here. We got a few extra ones in the room today too. I don't have your names written down, but I appreciate you guys being here. Next are pages. I don't have any pages names, but if you're here as a page for either the legislature or the governor's office, if you will stand and just give a little wave to the crowd. Thank you guys for being with us. Hopefully you learned something today about legislative process and legislative oversight. So we're here today because of an unimaginable tragedy and horribly inhumane death of a 6-year-old girl named Dominique Moody. A precious, fragile little girl who first responders found locked in a dog cage, surrounded by her own waste and covered with burn scars, ligature marks that were in various stages of healing, fractured ribs, and rodent bites. I want to establish first that there's an ongoing criminal prosecution in this case, and we will not jeopardize that. Dominique Moody's case will be tried in the court of law, not in this chamber. But what we will discuss today is the system's failure to keep children safe in this state, not just in Mecklenburg County, but a statewide issue. We must address this now because we can't afford to delay. Every delay means a child remains unsafe and placed in unsafe environments for longer periods of time. Delays mean more children will be harmed, and the failures that led to Dominique Moody's tragic death will continue. These were not isolated. They were not limited to urban counties. We've seen the system fail in rural counties as well. Failures have happened in big and small counties alike. There's a pattern here. A child dies, and the Department of Health and Human Services investigates, finds a lack of oversight, poor decision-making, and poor management. And the local Child Protective Services office is put on a corrective action plan, and the state takes over for a little while. But fundamentally, nothing changes. Dominique Moody's death could have been prevented. Let me say that again. This was a preventable death that occurred because of inaction. From the public record, Mecklenburg County's Division of Children and Family Services received 10 reports and deemed 5 worth investigating, but decided that the other 5 were not. Today we'll talk about how reports are handled, when a visit is made to a home, do prior reports prompt action, when a child is interviewed, when protocols are in place for communication between one team and another within a department. What role do the police play? What are the consequences when policies are not followed? Clearly, Mecklenburg County failed Dominique Moody. We would be foolish to think they failed so tragically in her case and acted perfectly in every other case. Time and time again, children are harmed or killed when law enforcement or social services ignores or downplays reports. Children suffer when those authorities disregard abusive histories, and this must stop. DHHS conducted an investigation of 122 Mecklenburg County DSS cases and found, quote, a broad systemic lack of appropriate safety planning to address identified danger indicators and risk factors to children. A broad systemic lack of safety planning. That's damning and unacceptable when the sole purpose of that organization is to keep children safe. To help us understand how we can prevent tragedies like this from happening again, we'll have 3 panels testify today. First, North Carolina Department of Health and Human Services Deputy Secretary for Opportunity and Wellbeing, Michael Leighs. Did I say that right? Is it Lee or Leighs? It's Leighs, right? You corrected me on the call earlier, so I appreciate it. And Director of Child and Family Adult Regional Support, Lisa Tucker Cauley. We'll discuss what their agency documented in its review of Mecklenburg County practices and how it's holding the county responsible to improve. They will be joined by Dr. Emily Putnam-Hornstein, who has requested to be called Dr. Emily for this meeting, a professor and researcher at the UNC School of Social Work, whose predictive risk modeling tools have been validated to keep children safe and reduce racially disparate outcomes in the counties around Pittsburgh and Los Angeles. We'll also be joined later by Charlotte-Mecklenburg Police Chief Estella Patterson and Mecklenburg County Sheriff Garry McFadden. And then they'll describe law enforcement's involvement with DSS cases and what normal policy and procedure looks like. We'll close with Mecklenburg County Manager Michael Bryant, Director, Department of Community Resources, Yolanda Griffin, and Interim Director of Department of Child and Family and Adult Services, Letitia Lodeholt. So, on to our first panel. Secretary Leighs, Director Cauley, and Dr. Putnam-Hornstein, if you would, stand up and raise your right hand. Do you affirm that your testimony is the truth, the whole truth, and nothing but the truth? Are all your microphones on? We'll go ahead and address that. If the green light is on, it's on. There we go. For the record, they all indicated that they do. So thank you. You may be seated. And with that, I believe we will recognize DHHS for your opening statement.
Thank you, Mr. Chairman and members of the committee. My name is Michael Leighs. I'm the Deputy Secretary of Opportunity and Wellbeing at the North Carolina Department of Health and Human Services. The Opportunity and Wellbeing portfolio is made up of 8 human services divisions, including child welfare services within the state's Division of Social Services. DHHS works every day to create a North Carolina where children are protected and families are safe. We take seriously our responsibility to ensure the health and well-being of children and families, and our goal is for every child to grow up in a safe and nurturing family and community. Today we are here to discuss the department's work in response to the death of Dominique Moody in Mecklenburg County. The death of any child is an unthinkable tragedy. The death of a child as a result of alleged abuse or neglect is even more difficult to comprehend. At DHHS, it is our job to engage and look closely at a child fatality to help determine what happened and what, if anything, could have been done differently. But as a father, I can tell you Dominique's death has affected me and the rest of my team on a deeply personal level. We believe that transparency is of critical importance here, and we have a strong desire to provide this committee with as much information as we can. At the same time, we are mindful of the state's confidentiality laws, and we take very seriously the department's legal obligations to maintain the strict confidentiality of all sensitive child welfare records and information. Because of this, there will likely be some questions you may have that we are simply not able to answer, particularly those that specifically pertain to Dominique Moody's case. But we will speak to the information provided in the corrective action letter the department issued to Mecklenburg County on May 20th, 2026. We have submitted written testimony in preparation for today's hearing, including information that our department has released publicly on our fatality case review, findings from our broader review of more than 100 child welfare cases in Mecklenburg County, and requirements of the resulting corrective action plan. The written testimony also provides proposed changes to improve child welfare outcomes in North Carolina moving forward, which I plan to speak to later in the testimony. With your permission, Mr. Chairman, I would like to ask my colleague, Lisa Tucker Cauley, our Division Director for Human Services, to speak to our work in Mecklenburg County.
Thank you, Mr. Chair. My name is Lisa Tucker Cauley. I'm the Division Director for Human Services at the Department of Health and Human Services. Certainly. The majority of my career has been working in the child welfare field. I began that career because I was the biological child of foster parents, and I saw the need for change. So both me and my team and leadership at DHHS share that desire to see positive outcomes for children and families, and I speak to you on behalf of that group as well as children and families in North Carolina. Most of us who work in child welfare for the state have been in this field for decades, and we can tell you that a child fatality never becomes normal. The death of one child is too many, and we feel it deeply every time. While the circumstance is tragic, we appreciate the opportunity to appear before you to speak on behalf of the department. Before I talk about this fatality and our case review in Mecklenburg County, I want to start by providing an overview of the child welfare system in general. Some of the information and data you will hear today is specific to child welfare law and practice, so I'd like to lay the groundwork with a quick explanation of the life of a child welfare case. We provided a handout that you can follow that outlines this overview. So, the first thing that happens is that a county child welfare agency receives a report of abuse, neglect, or dependency. Generally, we're going to call that maltreatment. A report can be in different formats. Typically, people call an agency, but they can also email, or even a citizen can walk in and give a report. It's the job of the local intake social workers to document these reports of maltreatment, ask sufficient questions of the person making the report to understand the overall risk to the child's safety, and then determine whether the information provided meets North Carolina's definition of maltreatment. And that is based on the general statutes, the definition of maltreatment. This is a two-step case decision that must be signed off by a child welfare supervisor. Reports that do not meet the definition of maltreatment are screened out, meaning they do not move along the Child Protective Services process. If a report does meet the definition of maltreatment, the report is screened in to move forward for further investigation. Based on the information provided and risk to the child, the intake worker must also determine whether the situation warrants an immediate 24-hour or 72-hour response. Within the appropriate time frame, the County Child Welfare Agency must initiate a CPS assessment to further investigate the information provided in the maltreatment report. At this stage, the assessment worker must interview the child and parents and assess where they live to determine safety and risk. The worker also reviews the family's child welfare history and calls collaterals, people like teachers, neighbors, doctors, or family members who can answer questions about the family's ability to provide a safe home for the child. In some cases, a CPS assessment may find no safety or risk factors requiring intervention by child welfare services. In these cases, the CPS case is closed with no further action. A CPS assessment can also lead to child protective in-home services, meaning the social worker identifies the safety and risk concerns, but also identifies that a child can remain safely in the home while these concerns are addressed. A safety plan is put in place for the family, and the case remains open with ongoing contact until the agency determines all areas of the safety plans have been addressed. If the CPS assessment identifies that risk cannot be mitigated safely while the child remains in the home, the county agency is responsible for petitioning the court to take custody of the child or children, and the child enters foster care. The case remains open with ongoing contacts as the county agency works to move the child from foster care to permanency, either safely reunifying with their parents or custody or guardianship to a relative, or even adoption. Assessment case decisions regarding what, if any, services to provide are required to be made in consultation with a child welfare supervisor. You will hear many of these terms: intake, assessment, screen in, screen out, and more, as I provide a summary of the information included in the state's corrective action plan to Mecklenburg County. I'm happy to answer questions about this as needed. Our department was made aware of the death of Dominique Moody in Mecklenburg County on December 16, 2025. In response, state staff conducted an extensive file review of the fatality case, which includes a complete history of the family's involvement with Child Protective Services in North Carolina. Our review of this fatality reveals serious concerns with Mecklenburg's child welfare practice, including numerous violations of state law, rule, and policy. For clarity, we've divided the fatality review findings that have been shared publicly into 3 categories. First, concerns about the 5 maltreatment reports that were screened out at intake with no further action. The second category is concerns about the multiple reports that were screened in, as well as the county's assessments of these reports. And lastly, concerns related to the county's decision-making at both intake and assessment. First, for screened-out reports. The state review found the following. 4 out of 5 total screened-out reports were screened incorrectly. In those 4 instances, information provided by the reporter did meet the definition of abuse and neglect, and the case should have been screened in for an assessment. For screened-in reports and assessment, the state found the following. Contacts were not made frequently enough to assure child safety. Protective services history was not reviewed, which would have shown a pattern of abuse and neglect. A lack of thorough assessment of the child's medical, developmental, and physical environmental concerns. Collaterals significant to the case, including medical personnel, were not contacted. The last category is concerns related to both intake and assessment. The state review found the following. Inaccurate case decisions were made that resulted in no services being provided to ensure the safety of the children. In short, Mecklenburg County received multiple reports of abuse and neglect and conducted assessments, yet failed to intervene further. As a result of its finding in...
Ms. Cauley, I apologize to interrupt. Really, can you pull your microphone down a little bit more? The public and some of the members in the back are having a hard time hearing you. Thank you, ma'am.
Okay. As a result of its finding in reviewing this fatality case, DHHS began a further file review across a large sample of Mecklenburg County case records to better understand whether the identified concerns existed more broadly. This review included 58 intake reports and 64 reports that were screened in, as well as the assessments that resulted from those reports. The review of the 58 intake reports revealed the following violations of law, rule, and policy. In 52% of intakes, intake workers did not ask sufficient questions to explore all alleged maltreatment. Reporter notification letters were not sent within 5 days of the CPS intake in 37% of intakes. In 36% of cases where reports contained allegations that did not meet the in 36% of cases where reports contained allegations that may have met the criminal definition of child abuse, case files did not contain verbal and written notification to the district attorney and law enforcement. The review of 64 assessment case records revealed the following violations of law, rule, or policy. Safety assessments had safety plans that were adequate to ensure safety in only 43% of the cases. Face-to-face contacts with children occurred at the correct frequency in only 48% of cases, with mothers in 52% of cases, fathers in only 34% of cases, and non-resident parents in 53% of cases. These numbers include diligent efforts to locate children and parents when a contact is unsuccessful. 45% of the cases did not document or show efforts to conduct a separate individual interview with children regarding safety. 64% of cases contained supervisory oversight at a minimum of every other week. 58% of cases did not contain all required components of quality oversight. It is important to note that our review of the 122 Mecklenburg case records, both intake and assessment, did identify several areas of strength in Mecklenburg's child welfare practice. At the same time, the state's review also revealed broad failures in critical practice areas, including a lack of appropriate safety planning, insufficient family contacts, and inadequate supervisory oversight. North Carolina General Statute 108A-74 gives DHHS the ability to take actions when counties fail to adhere to applicable federal or state law or rule including the ability to require a corrective action plan. The state sent a corrective action letter to Mecklenburg County DSS and Mecklenburg County leadership on May 20th to alert them of the requirement to develop a plan within 30 days to address violations identified in the sample case review. The corrective action plan must be approved by the state, and it must include, but is not limited to, the following: an immediate plan for how the agency will ensure current safety of children with an open Child Protective Services case, training for all staff on identifying safety risks, as well as planning for the safety of children when safety threats are identified, written protocols and processes to ensure accurate completion of and tracking for case initiations, ongoing contacts, and completion of all structured decision-making tools, effective use of Mecklenburg's internal quality assurance team to identify trends from file reviews and develop training to address deficits in policy, practice, and knowledge. Leadership develops strategies for providing ongoing and effective supervisory oversight for supervisors and social workers. DHHS leadership met with Mecklenburg County DSS the Mecklenburg County DSS interim director and senior staff on May 19th, 2026, as well as county leadership on May 20th, to share the findings of the case sample and to communicate the requirement of a corrective action plan. In summary, our review of this specific fatality revealed continuous poor assessment and decision-making by Mecklenburg staff in the most basic areas of child welfare practice. Our larger sample review identified practice concerns that will now be addressed through corrective action. Looking more broadly across North Carolina, there are statewide challenges within the child welfare system that impact outcomes for children every day. I want to make it clear that these systemic challenges are real and they put children at risk of remaining too long in unsafe situations. Before I ask your permission, Mr. Chair, to hand the microphone back to Deputy Secretary Leighs, I want to take a moment to speak about some of the challenges and how they are impacting our child welfare system in North Carolina. We hear from counties across the state regularly that they have difficulty in recruiting and retaining an adequate workforce. Rapid turnover has led to overall less experienced staff and loss of institutional knowledge in local agencies across the state. Caseloads can be unmanageably high, particularly in under-resourced counties. The complexity of child welfare cases continues to increase, in part due to the prevalence of unmet behavioral health needs, substance use disorders, and domestic violence. Some of these challenges have contributed to the state temporarily divesting counties of their child welfare responsibilities. Today, our department is actively administering child welfare services in 3 counties. 6 additional counties, including Mecklenburg, are currently completing corrective action plans. Our already stretched regional teams are covering for those who are working full-time in divested counties, and we are reaching the limit of our capacity to meet the need for both intensive technical assistance and routine monitoring for counties statewide. In short, change is needed, and our ability to create this change is limited by our county-administered, state-supervised system. Because of this, we appreciate the enacted provision in House Bill 696 to study state centralization of all social services, including child welfare. DHHS continues to work within our authority toward a more consistent, better quality child welfare practice statewide. But in a county-administered system, outcomes will always be influenced and impacted by the practice of the county where the family happens to live. This study will give us more insight into how to begin to address these challenges and improve outcomes for children statewide. Thank you, and with your permission, Mr. Chair, I would like to turn it back over to Deputy Secretary Leighs.
Thank you, Mr. Chairman, and thank you, Director Cauley. In addition to information about the Mecklenburg County DSS sample case review and corrective action plan, We appreciate the committee's request to discuss potential changes needed to improve the child welfare system. There are changes we can make now that will have a long-term impact on the safety, protection, and well-being of children and families in our state. First, state oversight. Legislation such as the Fostering Care Act, House Bill 612, has given additional authority to DHHS to intervene in specific case activities. This type of oversight is critical for the department to fully meet our responsibilities as the child welfare supervising agency for the state. The escalation team proposed in House Bill 1144, the Dominique Moody Safety Act, presents a similar opportunity, as that kind of team would give us the ability to intervene sooner with the goal of preventing fatalities. Second, system modernization. The General Assembly's continued funding to complete implementation of our new statewide child welfare information system, PathNC, is essential. This system provides important new tools for county and state child welfare staff to support children and families. This includes providing staff with automatic access to a family's complete CPS history, no matter where they have lived in the state. PathNC also guides county child welfare staff to better identify maltreatment and assess risk through newly redesigned structured decision-making tools built into the system. This system improves our ability at both the state and county level to monitor outcomes, identify concerns, and address problems before tragedies occur. We are pleased to report that all 100 counties are in PathNC for intake and assessments. We continue to roll out the rest of the system, which includes functions like child protective in-home services, foster care, and adoption assistance. After PathNC is fully integrated into county practice statewide, North Carolina will have the infrastructure in place to continue exploring other methods for modernizing the child welfare system, including tools like advanced analytics or predictive modeling that can help identify high-risk situations, as well as better services and placements. We are grateful for the General Assembly's continued support of PathNC. And third, supporting the workforce. Recruitment and retention of North Carolina's child welfare workforce are critical to improving outcomes. All counties must offer sufficiently competitive salaries to attract trained professional social workers capable of making life-altering decisions. It is also important for the state to look at ways it can offer additional support to help counties build and retain a qualified workforce. Our mission at DHHS is to ensure the health, safety, and well-being of children and families in North Carolina. In child welfare, that means a stronger child welfare workforce, better access to services, and more consistent county practice to improve outcomes, no matter where a family lives across the state. In alignment with this mission, we appreciate the partnership of the North Carolina General Assembly as we continue to work together to improve outcomes for the children and families we serve. We look forward to answering your questions, Mr. Chairman, and those of other committee members. Thank you.
Thank you. By way of just putting things in perspective for the committee, we're going to do both opening statements, and then we will question all the panelists in whatever order you guys choose to. While this opening statement is going on, if you want to go ahead and get in the queue, just signal the chair. Thank you. Dr. Putnam-Hornstein, your opening statement, ma'am.
Terrific. Members of the committee, thank you for holding this hearing. Thank you for the chance to speak. I'm the John A. Tate Distinguished Professor for Children in Need at the UNC School of Social Work. I'm a researcher, but for nearly 2 decades, my research has been grounded in the real work of child protection. I know what it is to sit with a case after a child has died, when it is painfully clear we failed to connect the dots. And I also know the difficulty of reviewing open investigations while there is still a child to protect. Much of the work I have done has been in systems built like North Carolina's, county administered and state supervised. I will not repeat the graphic details of Dominique's death. What I know is drawn largely from media coverage. Much has not been released, and while I'm no lawyer, I do not find the arguments that releasing information would compromise a prosecution at all persuasive. I will also add that this case underscores important questions about how we screen kinship placements as our agencies face relentless pressures to reduce entries to foster care. I'm here today to speak to a single question: what role might a predictive risk model have played in Dominique's case? When repeated community concerns signal a strong possibility of ongoing abuse and neglect, when the same family appears in our records again and again, At what point do we treat that pattern as the emergency it is? This does not appear to be a situation where the warning signs were absent. Some children die very young, tragically harmed by a caregiver, before anyone outside the home had reason for concern. Those deaths are no less devastating, but they raise a different question than the one before the committee today. Dominique was not invisible. From what has been made public, both law enforcement and Child Protective Services were inside the home repeatedly in the years before she died. Dominique was not a child no one saw. So why was there no action? It's certainly possible that adults simply chose to ignore the obvious, or even claimed to have made visits that never happened. Given how little has been released, we simply do not know. But I will say that the most common failure I see behind serious child injuries and deaths is this. We had information that we realize only in retrospect was critical to understanding the danger a child was in. Too often, we miss small but important details at each contact, and this builds across reports and across years. We fail to follow up on a medical report. We fail to verify a claim a parent has made. We fail to ask the right questions. We're too incurious, and sometimes we're simply too kind. Over time, it means child welfare workers often find themselves in the same home, seeing the same children, presented with many of the same concerns, but we still do not act because we don't feel as if we have sufficient evidence at any one of those isolated contacts. Connecting these dots across agencies, across years, holding dozens of encounters in mind at once and seeing the shape they form is something, frankly, that human beings are not built to do well. It is exactly where technology and algorithmic tools are so useful. They do not replace human decision makers or a well-trained workforce, but they do become incredibly critical decision support tools. The failure to see the pattern of risk in these reported calls is the precise gap a predictive risk model is built to close. And just for the committee's awareness, I think we often assume that we go out, we investigate once, and that's it. I regularly see cases where we've had dozens or more prior referrals. We often have many families where there is chronic involvement, and not all of those are families where the child is so endangered we need to intervene, but it does become very difficult to detect the signal from the noise. A predictive risk model harvests information from the full record the state already holds. It requires no new data entry. It uses machine learning methods to identify patterns that help classify risk. Our systems already store information. These new models and technologies help to surface it, and in seconds. Applied to a family with Dominique's history, repeated reports over the years, dozens of contacts with law enforcement, a child placed with a relative after her mother's drug use, her young age, I have to imagine a model would have flagged her case for closer scrutiny. The Federal Administration for Children and Families is now urging states to not just modernize their case management systems, as North Carolina is and has done, but to ensure the workforce can actually use the data it enters, not merely store it. Two counties highlight what this looks like in practice and what each raises about how a predictive risk model might have helped in Dominique's case. The first is Allegheny County, Pennsylvania. They built the first model more than a decade ago, and they built that model because they realized that their intake decisions were highly inconsistent across workers. Allegheny is sometimes described as the unicorn in child welfare. They have a comprehensive data warehouse. So their workers were being asked to review criminal justice, behavioral health, 911 calls, you name it. And they realized they weren't giving their workers at hotline screening the tools that were adequate to help them consistently use and weight that information. They realized they were screening out far too many calls where the family then came back and they were also intervening in cases where it could have been that they didn't actually need to go because they could have handed it off to a community partner. They have continued to use that model, and they have gone further since. So now their model is not just used to support workers at intake decisions, but they're using the model to flag especially complex, high-risk investigations, which are then escalated to an independent child safety team, of which I am a member. We monitor the case for as long as it stays open and elevate concerns with county leadership when the handling of it could place a child at risk. A second county, Los Angeles, has also implemented a predictive risk model. It is used for a very specific purpose: to flag the highest risk investigations for supervisors so that they can concentrate their attention and make sure that in any situation where an important detail is missed, these are the cases where we go and track it down. Their use of their predictive risk model has now scaled from 3 offices to all 19 of their regional offices. In Dominique's case, we do not know her full history or the histories of other children and adults named in those investigations or what was weighted, but certainly, again, I do think that a model would have absolutely identified hers as a case that warranted greater scrutiny. I want to be clear that these tools do not require perfect data. As I mentioned, Allegheny's model integrates cross-system information. In Los Angeles, they are only using child welfare records, and I will say that we are still using a system that was built in 1998. We are still waiting for our new case management system, and when the new system comes on board, that predictive risk model will simply pull information from the legacy system, integrate it with the new system until that is fully up and running. North Carolina does not need to wait. And the results are real. When these models have been studied by independent researchers, measures of child safety have improved. We had at least 2 RCTs in Colorado counties implementing predictive risk models where we saw statistically significant improvements in child hospitalizations for injuries. In Los Angeles County, the decision to scale countywide was based on a reduction in near fatalities and fatalities of 23% once we were equipping supervisors with this information. We've also seen that while there is significant concern that these models and tools could have disparate impact, that they've actually reduced racial disparities in Allegheny County and have had no adverse effects on racial disparities in other jurisdictions. Skepticism about government AI or algorithmic tools is healthy, which is why these models should be independently validated and always watched for disparate impact. But predictive risk modeling should not be mistaken for a vast technology project, one that North Carolina knows painfully well as it has moved all counties to a single case management system. It's an entirely different thing. It simply runs on the data the state already keeps. It does not require replacing everything underneath. As I mentioned, other states have kept these tools running straight through multi-year overhauls of case management systems. The team I work with was able to stand up a model in Idaho that was in use within 6 months of gaining access to the state's data. 6 months. And I think we have to move forward with real urgency when we consider every month we wait is another month where we are not using the best tools to support our workforce. We will not prevent every child death, but we understand more than we ever have about how to find children who are in the greatest danger using information the state already collects. North Carolina has an opportunity to put that knowledge to work. Thank you. I'm glad to serve as a resource to this committee, and I welcome your questions.
Apologies, taking care of some administrative stuff up here. All right, panel, we've got a few people in the queue. We're going to limit it to 5 minutes per member on the first round of questions. If you want to be in the queue and you're not, let us know. And Dr. Reeder, you are recognized for the first round of questions.
Thank you very much for being here today. And in my role in working in the emergency department, I meet with interact with the intake officers very often, but not so much down the role. So I'm really looking to understand the intake, the supervisor, and the assessment. So that's what my line of questioning is. Are the intake person, are they doing the assessment, or is that three different people that do those roles?
Thank you for that question. That would depend on the county and the time of day. So typically, there is an intake role, which is very different from an assessment role. So the call comes in, a worker takes the report. In large counties, they're going to have a number of people that take intake reports, and they do not do the assessment. Then once the intake report is screened in, it typically in a large county is going to go to another workforce, which are the CPS assessment workers.
So but the supervisor has to sign off on the intake, and that's the decision whether it's screened in or screened out.
Correct. In a small county, I have to say, in a small county, you might have the same person who does the intake, who does the assessment, but there would still be a supervisor that signed off. And after hours, you would typically find the same person who took the intake that went out and started the assessment if the time frame was within that weekend or holiday.
Okay. Talk to me about the typical role of a supervisor.
Thank you. That is a very interesting question. Supervisors are critical in child welfare. They are the entity that really keeps the work moving and ensures children's safety. We call them we call that a second level decision making. So a worker might make a decision, but that decision has to be affirmed by a supervisor both at an intake and in a safety plan and when there's case closure.
Okay, so the supervisor will sign off both on the intake and the assessment?
Yes.
Thank you. In your letter to Mecklenburg DSS, in your case review, you indicated that 64% of the cases contained oversight at a minimum of every other week. Is that the minimum requirements, is every other week?
Yes, that's correct.
And they had a performance at 64%. Would you expect better than that?
I think that what is important for child welfare workers is that they have regular supervision so that they can staff cases, make decisions with the supervisors. So you're always looking for that the social workers to have that regular contact. So you would want, and a part of the corrective action plan would be improving that percentage of those every other week conferences happening.
What would you expect it to be? Close to 100%?
I think that you always want everything at 100%, but I'm going to give you, can I give you
Sure.
When we look at counties that have had a corrective action plan coming out of the corrective action plan, you look at 85% as the threshold.
And would you expect more regular than the minimum if the case was at higher risk?
Contacts with families,
No, the supervisor oversight. Would you expect if it was a high-risk case with multiple calls that there would be more than that minimum of every other week?
so you would expect them to meet regularly with the supervisor every other week, and you would expect in those supervisory oversight conferences that those high-risk cases would be staffed more often.
In 58% of the cases in your report, you said that they didn't contain all the required elements of quality oversight. Again, 58%, more than half. Are those components standard? Those elements?
Yes, they are. They are.
Okay. Have they changed in any time recently?
We would have, I can't speak to that. It's likely when we did a lot of changes to policy when all counties went into PATH, we more than likely added more components to supervisory oversight.
But those standards are not hidden. They're well known by every social service worker across the state?
That's correct.
Okay. Can you talk a little bit about the typical qualifications and training for a supervisor?
So all social workers in North Carolina, before they have, I'm going to go back to being a worker, because before you're supervisor, you have to finish basic training. So the qualifications vary from county to county. You are looking for someone that has a human services background, primarily, your preference is to hire a bachelor's level social worker, a master's level social worker, but the majority of our workforce is not that. So all workers, and this is before you, including supervisors, before they can take cases, have to go through our 6-week pre-service training where they are trained in how to do basic child welfare work. That would include safety planning, that would include intake. It's an overview of all of child welfare work. For supervisors, there is additional training that they go through to learn how to be that second level decision making, to learn how to coach, to ask questions, to make sure that they can lead staff into the right decisions.
And what's that extra training that they go through? Is it the extra training to be a supervisor, you said? You said there's initial 6 weeks, but you would expect more?
Yeah, there's extensive training for child welfare workers. There's the pre-service training. They have, we call them
And I'm mostly, sorry to interrupt, I'm mostly interested in the supervisors, because you said that they're the linchpin.
Okay. There is training for supervisors. They go through a supervisory training course.
Is there a minimum time in that role before you can be a supervisor?
No, there's not. And I'll also say that while the law requires a certain number of hours for pre-service training, it does not require that supervisors receive any training other than the pre-service training.
So that might be something for us to look at.
That's correct.
We're here because we had a tragic case, and DHS described serious systemic failures. And you mentioned before that you have 3 counties under your direct supervision and 6 under corrective actions right now. Is this a typical number that you see, or how many in the last couple of years different counties have been or are under? And can you tell us the 3 that are under your direct supervision now?
So the 3 that we are currently have direct authority over child welfare services are Vance County, Bertie County, and Davidson County. The state has never had 3 at one time, so this is new. There are 6 counties that we have divested directors of duties in. 1, Bertie, twice. So there's 5 with Bertie twice. Corrective action counties, it's 20. I think it's 24. I could follow up to provide the actual number.
So it's not an uncommon or an isolated county failure in this that's going on right now?
I think that the corrective action plan, our corrective action plans is a plan we put in place to help counties correct. It is a part of our oversight.
Does DHHS do...
Dr. Reeder, your 5 minutes is expired, my friend.
Okay, sorry.
You're fine. I can put you in the queue for a follow-up if you like. With that, Representative Sheetzelt.
Thank you, Mr. Chair, and thank you all for being here today. I think it goes without saying none of us really wants to be here, but I appreciate you being here and being willing to talk with us today. I want to follow up a little bit with some of the questions that Representative Reeder was asking. First about, Director Cauley, you mentioned that supervisors are second level review. They are taking it, the first, talk to me first about the first level review and who is doing that first level of intake and what sort of decisions are they making? What sort of questions are they asking?
Okay. So intake, I will say intake in North Carolina is improved. All counties are now in Path NC, and there are structured decision-making tools that help intake workers make better intake decisions. What happens is you ask a person, tell me what you're concerned about. You let people talk. And then you look at what did they tell you. Our tool helps you look at that within the context of the legal definitions of abuse, neglect, and dependency. And if it meets those legal definitions, it's screened in. But you also ask questions about, is the worker safe to go to the home? So you gauge safety of the worker. You ask questions so that you know immediate risk of harm to the child. Who do they live with? So you know how. There are times when children are approached individually at school before you talk to parents. You've got to figure out what's the safest way to approach that situation. Mm-hmm. And so the tool walks intake workers through that process, gives them prompts so that they can come to the best decision as far as abuse, neglect, and dependency. And then the time frame is automated based on what what the information they put in. It gives you a time frame. So a worker gathers all that information and they land at a place of, is it screened in, screened out with the time frame? A supervisor is going to look at that and affirm it. And it may be that the supervisor looks at that intake and says, you need to go sooner. Because no matter what this says, like Dr. Emily said, you do need social workers who make those decisions. A supervisor would know at that point you need to go out and give directions.
So let's talk really quickly then about, I am an attorney. I think a lot about, I do a lot of appellate work, so I think about standard of review. What is that standard of review that the second level, the supervisor puts on that second level review? Are they looking at it and is there a bias they are supposed to exercise one way or another toward advancing it or to screening things out? Or is this purely de novo review? They're looking at this with fresh eyes. What's that standard?
So they are looking at it with fresh eyes to determine, did the worker capture all the information that is needed to know so that they go out, so that the worker that does the assessment is safe, so that they gauge the right time frame. Okay. And I would say the primary role of the intake supervisor at that point is, are there other questions you need to call back and ask? Okay.
So let's turn specifically to the file review in this case, in Dominique Moody's case. Have you had eyes on, for example, the screened out reports? Have you had eyes directly on that information and, what was not asked, what was screened in, what was screened out? Are you familiar with the facts of those individual reports?
So I can talk about the case sample in Mecklenburg. Mm-hmm. As we talked about, I'm not allowed to talk about the Dominique Moody case.
Yeah, I'm not necessarily going to ask you about the granular facts. I just want to know if you have that knowledge so that we can ask other questions beyond that. For example, let's see. Pull up the letter from DHHS. It says, of the total number of screened out reports, 4 out of 5 reports met the definition of abuse and neglect for this family and were screened out with no further assessment of safety of the children. Now, again, I understand as an attorney that definitions there can be gray areas and whether or not something falls within a definition or does not. And I guess my question is generally, of the 4 that were screened out that should not have been screened out, how squarely would that have fit within the definition had they been, properly screened?
So I'm not going to speak specifically about the case. What I'm going to speak about is how we review intakes as a state. So when DHHS goes in and does a file review, a review of intake of any case, we look at, was the information in the intake, like what was there? And then we look at, did it meet the abuse and neglect definition? If the county screened it, if it was there and they screened it in appropriately, we say you do that appropriately. If we see the information in any intake report, like you see what the reporter said, and it's there's allegations of abuse and neglect in what they said and they screened it out, those are cases where we would say in our case review, this was not screened appropriately. So we're looking at the content of an intake report when we do any type of case review.
And I just want to be clear, I'm not asking about the details of what are in these reports. I just want to have some information about where the failures are here so that we can do our jobs as the legislative body here. What were some of the most common questions, do you think, that go unasked based on not just the Moody case, but the entire review? Where were things falling through the cracks here in terms of the intake questions that should have been asked but were not?
And I'm going to speak to you about the sample that we looked at.
Yes, please.
Okay. So when we looked at their intake screening, and this is a sample, this is after Path NC. Remember, I said there were tools that helped you get intakes right, that happened when counties went in Path, and Mecklenburg went in Path NC in October. So when you looked at their screening in the case sample, they did really well. They screened the right cases in. But there's a different level that we noted in a need for improvement in the corrective action plan. And that was that they needed to ask more questions in their intakes, because those questions determine how fast you go out. So we've talked a lot about children staying too long in unsafe situations. If you don't ask specific questions, you don't know what's the level of risk. Somebody calls and says there was someone in the parking lot, beating their child. What does that mean? Were they hitting them with something? Was it their hand? Like, what happened? All those questions are specific to intake that you have to ask, so you know what is the current level of risk right now. Questions about who lives in the home. Just questions that help you gauge what is the time frame and what do we need to respond to now.
Representative Dahl, you are recognized.
Thank you, Mr. Chair, and thank y'all. And I'm not sure who to direct this to. I'm more interested in, it appears that there was a lack of even somebody with glasses on in this case. When I worked with children in the homes, and we were told, if there was feces on the floor, or if there were animals in there that were not pets, that we needed to report that directly. And so I'm wondering, so how many visits does a typical CPS worker do in a day? That's just a general.
So I think let me talk about what we expect. I'm going to talk about a case and see if that answers the question. If not, I'll talk about a day. A CPS worker, we talked about that intake screening, and you screen a report in, you go based on that time frame. So it's immediate. That's go now. So you would go out immediately. You have to see the child. You have to see the parents in the same time you initiate, children and parents at the same time. Then follow up with collaterals. We expect for all cases that there be at least a visit every other week with no more than 7 days, with no less than 7 days in between. That's a minimum. But for high-risk cases, you would expect workers to go more often. So if you have a high-risk case that you're worried about, you might be going every week. You might be going more than once a week.
Okay, excuse me. I understand that. What I'm trying to figure out is, what is a caseload for a person? Because oftentimes people are required to do 5 visits in a day, which is a lot? Or is there a requirement? Because what I really want to know is how much paperwork is involved and how much actual visits are involved. Are there uses of artificial intelligence or a note-taking tool, or do they have to handwrite? I'm more interested in, what I'm trying to get at is, we may have a very failed system, but we may also be failing the people that are working for that system by requiring more than is humanly possible.
So thank you for that question and for your support of our workforce. So the recommended caseload for a Child Protective Services assessment worker doing this work is 10 cases. That's the most we would want them to have. I can tell you, and when I talked in my opening remarks, there are concerns that the caseloads are much higher than that. And so that's why we said there needs to be some support from the workforce. Counties bear the majority of the funding for their workforce, and so the caseloads depend on where you work. You have counties that are able to keep those caseloads under 10, but you have other counties that do not. When I talked about the complexity of the cases with more substance use disorder, domestic violence, behavioral health concerns, counties say even 10 is more than what they can handle. So I think that's a place that there needs to be a look at.
One other question is, what are the credentials for someone who's are they a licensed social worker, or are they trained in, certain, what are our training? What are we looking at when we're looking for someone who is going in the home and doing either intakes or visits?
So those credentials are going to vary from county to county. you would look for, I mean, you want someone with a college 4-year degree. The reason that pre-service training is so important is there are 2 levels of that training. If you have a social work degree, there's parts of that training you do not have to take, because we want people to enter the workforce as soon as they can with the training they need. But if you come from a human services background, criminal justice background, something that's not social work, you have 2 additional weeks at the beginning that you have to attend.
And I had a follow-up, but I've forgotten it now. Oh, well, I'll come back.
You've got about 7 seconds to remember it. No, you good? All right, cool. Representative Campbell, you're recognized.
Thank you, Mr. Chair. Mainly, these questions will be about the 122 case reviews. And I'm going to focus on a specific part of that. But before I do, in terms of, we talked about 52% of intakes. They did not ask sufficient questions to explore the alleged maltreatment. Did you find common questions that were missed? Was there a pattern at all that you saw in that review?
There's not a pattern that I could share with you today, but I could have our team follow up and provide that information for you.
Okay. Now, to set up what I'm going to ask for in a minute, it is true that you guys found that 36% of cases where reports contain allegations that may have met the criminal definition of child abuse, case files did not contain verbal and written notifications of the DA and law enforcement, correct?
Correct.
And that is state law to do so, correct?
Yes, it is.
The reason I ask that is it also seems like that less than half of the time in these case reviews, there was not face-to-face contact with the actual child. Is that correct?
There was face-to-face contact. There wasn't enough face-to-face contact, and there were concerns that there was not. You have to see children individually, alone, to give them an opportunity to disclose any information they might not say in front of a parent. And that did not happen in all the cases.
Well, that was my follow-up question. Do you have information? Now, you say that some of these cases were not enough contact. I guess the first thing I asked is, of the face-to-face contacts that did happen, do you know what percentage of those the child was actually alone when questions were asked?
No, but I could follow up and see. I do know that was one of the concerns and one of the areas that will be addressed in the corrective action plan.
So would you say that the less than half that I'm looking at where it says there wasn't face-to-face contact, you would say it was either no face-to-face contact or insufficient face-to-face contact?
I would say there was insufficient if you look at face-to-face contacts with children occurred 48% of the time when you look at when they would have been expected to occur.
Yes. Now, are you saying that 48% was when it did occur?
Yes.
So the remainder did not occur at all or did not occur sufficiently?
Did not occur.
Did not occur. Okay, that was my original question. Okay, getting back to the required report to DA and law enforcement, I'm at a loss as to how that can even be done without a face-to-face evaluation of the child to even determine if the DA and law enforcement should be contacted.
So that requirement is at intake. It starts at intake. So if someone reports, often people will say information about child maltreatment, and in it, there is information that is a crime against a child. So there's an expectation that even at intake, that be provided to law enforcement and the district attorney.
I guess the way I'd ask it, and I'm just trying to get your opinion on this, is if there wasn't an obvious report of abuse that would trigger that call, and no one bothered to look at the child, is there a tremendous opportunity that abuse could be there and there wouldn't even be the opportunity to report it, even if they decided to?
Okay, so let me go back, because I did find that percentage. 45% of cases did not document or show efforts to conduct separate interviews with children regarding safety. So that's that individual. So when I'm speaking about the reports to law enforcement or the district attorney, that's when we did a case review, we saw that evidence in an intake report, and it didn't happen. There are, if you don't interview children alone, if you don't see them within the required time frame, there are missed. That's why those things are so important, because they are missed opportunities.
If I may, Dr. Emily, I have one question for you, if I may. I love this model, and it's almost like a triage aid in this process. One of the concerns I wanted to get your thoughts on. One of the concerns I have, both from an upstream and a downstream. From an upstream standpoint, it does appear that predictive risk modeling does require or depend upon adequate documentation of encounters from the department. Otherwise, the model, what you draw from, will be flawed from the beginning. Is that correct?
It is correct that if we have absolutely no history from or involving the family, the model would not be able to run. In Allegheny County, that's true for around 10% of calls that come into the hotline.
Okay. And then the other thing, the downstream concern I have is that this model also depends on, when you identify troublesome areas that need further evaluation, that this model, to be successful, depends on that downstream person in the department actually doing that, correct?
That is correct. What the model helps us do is to focus attention and, I think, to create important accountability mechanisms in terms of making sure that there is that downstream action.
Okay. And final question, Director Cauley. In the response to the committee, and this is about the Moody case specifically, so please, if you can't answer it, just please tell me.
Okay.
But the committee was told that CPS history was reviewed, that medical collaterals were contacted, and the child's physical condition was documented with each visit. It does not appear that your report agrees with that assessment. Is that true?
Can you ask that question again, please?
So in the county's written response to this committee, they state that the CPS history was reviewed, the medical collaterals were contacted, and the child's physical condition was documented at each visit. This is for Moody specifically. It does not appear that your review agreed with that assessment. Is that fair to say?
Can I want to check. Let me.
Of course, yeah.
Thank you. I want to give you as much information
Sure,
as I
and thank
can,
you.
but I'm not going to be able to answer that.
Okay, that even includes the letter that was already supplied to this committee that stated that, which is public record, correct?
Our review did reveal that there were collaterals that were not contacted.
Okay. Thank you, Mr. Chairman.
Thank you. Just real quick, I want to follow up on a line of questioning. So you testified that there may be occasions when it's not safe for a worker to go to a home. What conditions could exist that would make it to where and I'm sure there are some, that's why I'm giving you the opportunity to explain it, but what may exist in a home that would make it unsafe for a worker to go there but make it safe for a child to remain in that home?
So it's never not safe for a worker. A worker goes. There are times when a worker goes with a law enforcement officer. So let me clarify. You do go, you call and ask for a law enforcement escort. Some of the things that would make you concerned would be if you looked at who lived in the home and there were people there that you knew had been, were dangerous, or had criminal histories that you were concerned about. Those are the types of things that you tend to call and ask for a law enforcement escort. And there are some counties that just because it's late at night and they have to go immediately late at night would call on their law enforcement partners to go.
Okay. And when you guys do a case review, how are the cases and files that you guys review, how are they chosen?
We do a random sample.
And how do you get the sample? Is it provided by the county or do you go in and claim the sample yourself?
We claim the sample ourselves. The cases being in Path NC now make it much easier for us to find a sample of cases.
And how do you land on the number of cases that you find appropriate for a sample size?
We look at the size of the county and the number of cases that they serve, the families they serve.
And where's the sweet spot as far as what you're looking for as a percent of the total cases?
I think we're just looking for enough cases that we would have, I don't have a percentage for you, but we look for enough cases so that we would be able to tell trends in practice.
So my question is, how do you determine whether it's going to be statistically significant?
Our team has that information. I'll follow up.
Thank you, ma'am. Next up will be Representative Servania.
Thank you, Chair. Comments and questions to the people here. Thank you. Before I begin with my questioning, I want to acknowledge the tragic death of Dominique Moody. No child should ever have to experience what that young woman, young girl had to endure. So my thoughts to everybody who was her loved one and all those affected. I want to provide some background. A large part of my career was in Child Protective Services, including working in Texas that provided, after child death, $2 million in 2005 to reform CPS, which included more quality assurance in terms of intake, investigations, and all sorts of things, and really a lot of mobile technologies and to make sure that our workers had everything that they can to reduce the time to investigate and go through the process with a child and a family. And also a performance management system that included, at the time, a SACWA system at any point of time knowing where that child is, where that worker is in that case, and that there's accountabilities put in place. So I'm gonna go back to old school because it's great that we would have a Dominique Moody Express team and a child fatality investigation, but that's way too late. It's also too late at quality assurance. It's too late. Our basics when it comes to Child Protective Services is the worker and is the supervisor. So I appreciate my colleagues' questions on that. So I'm going to ask, at this time in Mecklenburg and in our counties, how is a caseworker actually capturing the case? Are they still handwriting it, or do we have mobile technologies that go straight into our NCPath system?
Thank you for the question, Representative Servania. So Path NC is now live in all 100 counties for intake and assessment. So we will roll out more modules throughout this year. We call it ongoing case management. So that'll be in-home services, that'll be foster care, that'll be adoption assistance. That's rolling out. We have 11 counties who are in all the modules. But we'll roll out to those remaining 89. But the good news is there are 100 in the intake and assessment model. So that is giving them a tool that they did not have before. It includes structured decision-making tools to guide workers to make the right decision at intake. And the great thing about PATH is that we can capture data for a variety of reasons, right? So you can do quality assurance easier. You can look at trends. We're building dashboards with county input so that not only the county staff can see trends and have a leg up on quality assurance, they can also look at workloads of workers, but those dashboards will also give our team more insight into things that we're seeing. So PathNC, again, appreciate the support from this body. It is going to be a game changer, I think, for our counties to give them that tool. It will also help us tremendously in terms of just for the sample, as Director Cauley talked about. It was easier to do that because of PathNC. It will be easier to see trends going forward. So that system, we feel, is going to make a very big difference, and we hope we can look at things like predictive analytics as the system is fully implemented. We will have more data at that time, so we are very excited to consider tools that cull that data so that we can be predicting high-risk cases.
So let me go backwards, and it's a stepping stone with my colleague here, Representative Campbell. I'm asking how that data is put in to NCPath. Are you still, is there some, like, are caseworkers still writing and Or are they actually, like in Texas, we integrated a mobile technology. It went straight in once they synced it at Starbucks or whatever hotspot they had. Data that's well put in before a predictive model is going to give us the best way. So how are our caseworkers putting input in?
So, Representative, I'll start there. That we do have mobile functionality for Path NC. It is a system based on Salesforce, so it has a number of screens that a worker would work through to enter this information and would get prompts back. But I'll hand it off to Director Cauley. She's going to talk probably in more detail about what it looks like at that worker level.
It is much improved. I was a handwritten worker myself. It is much improved. And it no longer has forms. It is a big lift for our workforce. So you go in and an intake, it gives you, it has all types of, it has all types of tools that help you. You can hover over it. It'll take you to the policy manual. It gives you, if someone calls and says something about medical neglect, it gives you questions to ask about medical neglect so you take better intakes. It has all kinds of prompts. It is going to be the basis of what changes our child welfare system, and it does have the information that's needed for predictive analytics.
So you're saying they're not handwriting anymore?
No, they are not handwriting.
Because that's a lot of times where that inconsistency in terms of a case happens. You'll have our workforce is quitting, you have files in some sort of rolly or in a desk, and we've had child deaths that happen because sometimes that happens. So thank you for clarifying that. So let me go into...
Can I follow up?
Okay, yes.
Representative Cervoni, your time has expired.
Yes, okay.
Director Cauley, you may follow up with your answer.
It is a enormous transition for our workforce, especially those who did write to take notes and then put in. So you're still going to find some workers who keep that notepad that write, especially when they're with families, and then put it into the system. But the system is designed to be able to put it in as you write your notes, think of your notes, and it has some interactions, some parts of the system you can do with families.
Thank you. Representative Willingham, you are recognized, sir.
Thank you, Mr. Chair. Most of my questions actually been answered. I was going to ask you about the path that you put in operation, where it is at this point, and you've answered that. I was also going to ask you about the number of cases that on average is assigned to a social worker, because in most cases it seemed to be more than what's recommended. But I do have one question. It seemed to me that as far as training is concerned, that there's no uniformity in training of these persons who are doing the investigating and also people who are doing the intake. So it also appears to me that depending on where you are, which county, and the resources they have, that in some kind of way seem to indicate whether a child is safe or not safe. And that, again, gets to the level of training and the level of competency that the people have in those counties. But has that been something, or is there something that you're doing to try to address that? So if you live in my county, in Edgecombe County, I mean, you'll know you're just as safe as someone who's living in Durham County or Mecklenburg County. So, but I don't see any kind of uniformity when it comes to the level of training that these social workers have, or non-social workers. You say they're probably most of your people are non-social workers, and they probably should have some kind of social worker degree or something in that area. So is that something that you're addressing, you looked at, or considered?
Thank you for those questions, and they bring up a lot of information. So the training is uniform. All child welfare workers, including those who eventually become social workers, go through uniform training. The training, it is training before they meet with families, and it's training where we test their knowledge after they finish the course. What has to happen next, though, is you can't just train people and expect that they learned it and they're done and they're going to be good when it is things that are as important as how do you assess a child's safety. So there has to be time for them to learn how to use that training, how to apply it with families. So I'm going to tell you, in the best of worlds, someone would go through that training and they would do their first, let's say, four weeks. They can have some contact with families. They would get a few families to interview with someone like a supervisor sitting beside them, making sure that they use what they learned. They would get that caseload of 10. They would gradually build up to a caseload of 10, and a supervisor or someone on a training team, large counties have training team, would observe them to make sure that they really are applying all the things and skills that they learned. That's what really needs to happen. It's not that the training does not exist. And the training is good. Workers appreciate the training. They give us researchers at UNC have evaluated the training and the value of it. But what happens is you finish that training as a worker, you finish all those number of weeks you go, and immediately you get that caseload of 10 or more. And so you might end up in a county where, because of the number of cases they have, not enough staff, you get 15 to 20 cases. It's hard to hold on to what you learned, be able to practice when you're in that crisis setting, you have too many cases. So the issues go back to, it is workforce, it is counties having the capacity to allow new workers time to enter the workforce and use what they learned.
Thank you.
All right, Representative Quick, you are next, sir.
Thank you, Mr. Chair, and good morning, and thank you all for being here. I think everyone in this room and across the state will agree that there are two words that are disconcerting and unsettling to all of us, and that is child death, particularly when it is preventable. The questions I have for you I represent Guilford County, which is about 1/3 the size of Mecklenburg County, and we've had some similar concerns about our child welfare system. I haven't, Representative Reeder and Representative Willingham and others have asked a question, but I don't know that I've gotten the exact answer. I've heard you say, Director Cauley, that you would look for someone who has some requirements and your preference is someone who has a bachelor's or a master's at social work. What are the minimum requirements for someone to be a child welfare worker in North Carolina?
You have to these requirements are going to vary from county to county. You do have to have a 4-year degree, but you have different requirements based on the county's personnel requirements.
You mentioned earlier, and I'm going to jump around a little bit, you talked about face-to-face contact. I'd like a definition for what does face-to-face contact mean. Does that mean that I, as a child welfare worker, see a child, or am I questioning the child?
That means that you see the child, you talk to the child, you interview the child. If it's a baby, you're going to make sure do a body inventory, make sure the baby is okay and there's no harm to the baby. But that is the term we use to mean you made contact, you saw the child, and it's important because
again, you said you made contact, you saw the child.
Yes, and I had an opportunity to interview.
So I'm asking the child, did you eat? Have you bathed? Those type questions.
Yeah, and we ask very open-ended questions. Tell me who you live with. What's it like to be in your house? What do you like to do? What do you worry about? We ask all those open-ended questions after we give children time to warm up to us, so that they have an opportunity to tell someone in a helping profession role if there are things that are concerning.
Do you have any demographic data on the average number of years of an average child welfare worker in North Carolina? You talked about turnover and those type things. Do we have any data on how long the average person stays in that position?
We do, and I can provide that to you.
Thank you. The other thing, you do random evaluations of counties. You said that your department comes in and does random evaluation of counties. Do counties do random evaluations of caseworkers? In Guilford County, is a supervisor going in and saying, hey, I'm pulling 5 of your files today, just at random? Does that happen?
So that would vary from county to county. In a large county like Guilford, they have quality assurance teams that would go in and pull those records. One of the most important things for counties is to have protocols so that you know how that quality assurance and how those records are pulled and when it
I'm
happens.
gonna cut you. Why is that not required of every county?
Because some counties, some of our very small counties have 2 workers that do child welfare, 2 to 4 very small teams, and they wouldn't have the ability to have a quality assurance team.
Yet they are responsible for children. So why would there not be a baseline requirement that someone goes in and audits the caseworker in every county?
I think that I agree. There needs to be oversight. In a state supervised county administered system, it is the requirement of the DSS director to make sure that child welfare services are delivered as intended. So it would be up to that DSS director to determine how that happened. In a large county, it could be a quality assurance team. In a smaller county, it might be a supervisor pulling records.
But is there a baseline requirement from the state that happens, that there's random audits of case files? Is that a baseline requirement in the state?
For county staff, for counties, no. We do teach in our supervisory course for a supervisor how to review a record.
Okay, last question that I have. Mecklenburg County grows by about 21,000 people per year over the past several years. That's the equivalent of moving Boone into Mecklenburg County or Lexington into Mecklenburg County. With that number of people who are moving in, is there any data that shows us the number of people who move into Mecklenburg County or large counties? How many of those people will need DSS services in 2 years, 5 years? I'm talking about food assistance. I'm talking about housing assistance. Is there any way to predict that, or any data that would show us that those needs would be coming into our larger counties?
Not that I am aware of. I think
You would agree that with 56 people per day moving into Mecklenburg County, some of them are going to need at some point in time DSS services. And I didn't mean to cut you off, but
that's correct. And I think some of when we look at larger systems changes that would happen, helping counties being aware of that and knowing in a way that, because that is important if you think about staffing. If you know you have this many number of people that move in, you have this percentage of usage of child welfare services, knowing that information would be helpful. What's different though is how often people are reported varies from county to county. So you would have to know that as a baseline for each county.
I have one further question. If I have time.
If it's short, I'll allow it.
I promise you it'll be a quick question.
Yes, I bet.
Yeah, all right. Timeliness of processing additional services for families. For example, a family needs food assistance. In our larger counties, we're having a problem with processing those needs for services, which could lead to neglect, which could lead to frustration on behalf of parents, which is oftentimes inappropriately taken out on children. What are we doing to help with processing timeliness of additional services?
Representative Quick, I'll take that one. So it's a great question. And within my portfolio, we oversee the SNAP program, for example. And so there are federal requirements around timeliness processing for each county. And so we monitor that. When we see disparities, we work with counties. If it happens on an ongoing basis, we will put them in a corrective action plan and try to give them the supports to get that number down. I will say, we are seeing stressors on the county workforce to keep up with some of the demand, especially around food insecurity. I think you're absolutely right to lift that up as one of the contributing factors when we see kids who are in situations of neglect. So it is all interconnected. I think that is part of our agency's focus to kind of have those supports in place too, and that is our responsibility to oversee and regulate when counties are not keeping up with something like timeliness of processing applications. So it's a point well taken. It's something that we take seriously.
Thank you.
Representative Quick, your microphone's still on, sir. Just a quick follow-up. Representative Quick triggered something in my brain. So in those meetings that you're making reference to, Ms. Cauley, how many of those should be occurring, say, on a monthly basis while a child is in care? How many face-to-face meetings should be occurring?
So is that question about children in foster care or open for CPS assessments?
I mean, we'll say foster care and a familial placement.
So if a child's in foster care, it's required that they be seen once a month, and it's that face-to-face, allowing them time to give information and to give them a safe place and time with their social worker.
So fair to say no less than 12 times a year?
Correct.
Okay. And so if in theory a child was in the care for 6 years, it'd be 6 times 12 would be the number of these face-to-face meetings that would have to take place?
If they were in foster care.
Okay. And each one of those, the questions that Representative Quick was talking about that should be asked would be asked of the child. What did you eat? Are you bathing? Essentially, are you being abused or neglected? Are there any concerns? They would be examined in some way and they'd be asked questions, correct?
They would be asked some questions. I think it would depend on what, the social worker over time has a relationship with the child. They would probably follow up on things that happened the previous visit. If you knew the child was eating and they looked healthy and they'd been in a family that was a good fit for them, you might not ask the questions as specific to, are you being fed? You would ask more open-ended questions like, tell me what's it like to live here? What do you like? What's going well? What are you worried about? You would start there. Just so that it would be open-ended, because it may not be about where they're living. It might be school. It might be things with their biological family.
And is there a preference on where these conversations take place? In the home, outside of the home?
Yes.
At school, at a doctor's office?
In the home, but in a way that allows them individual time with their social worker.
Okay. Thank you. Representative Cunningham, you're next up.
Thank you, Mr. Chair. Let me try to get a little bit closer. I'm not sure who needs to take this question, but I want to talk about the PATH program. It just got up and running, and what we found is that the dots were not connected in this particular case, and lots of other cases, is the calls that came in. Who captures the calls that come into 911, and how do DSS get that information? We noticed that not just the 911 calls, but also the other calls associated with first responders, police officers going to the area. How is that captured? Who captures that so that the department, DSS, is able to see the connection of the dots? Is PATH going to be able to do that?
So when 911 or a law enforcement officer gets anything that is a Child Protective Services report, they're expected to make a report to the Department of Social Services. There's also a requirement in policy, so that reporting is by law. That has to happen. We talked about the notice when a citizen calls or someone calls in and there's a report to the district attorney or there's allegations that there's a crime against a child, that report goes back to law enforcement. So there's a working relationship between Child Protective Services and law enforcement that is critical to each conducting their own investigations, the assessment for the Child Protective Services worker and the criminal investigation or for law enforcement. The other thing that's in policy for child welfare workers is they're expected to check 911 logs during a CPS assessment. So if there's any criminal activity in a house or there anything that you need to be concerned about for children living there, they check those logs just to see the number of calls to the house.
Thank you. Another question. I noticed as I was reading some of the documents, the department made several referrals to other organizations that would look at children, such as child development or family or medical. When a child transfers from one county over to another county, don't the medical records supposed to follow them?
So is your question about a child open to protective, tell me about the.
So if a child is in Montgomery County and they've already been involved with the welfare system and they transfer over to Mecklenburg County, maybe in Mecklenburg County, the medical records should follow the child to the new county, correct?
So are these medical these medical records that Child Protective Services has access to?
Yes.
Okay. So best practice prior to Path NC was that if there was a case that showed up in Montgomery County that came from another county, that information would be sent to the county that had the case open now, would request the information, and the county that had previously would send it, electronically in some way. But you're relying on facts, you're relying on sending it that way. Right now, you have a system where all counties can see Child Protective Services cases in PATH. And so you don't have to it's a pretty easy process in PATH if a child has been served in one county and then that case is closed and the case opens in another county. They will eventually have access to all that information as cases are gradually added into PATH NC.
Okay, so let me go back to the referrals. So when a referral is made out from the DSS department to another organization that's supposed to look at the child, or they recognize the issue is there, they're saying, okay, I want you all to do this assessment. Additional information is needed to determine whether it's substantiated or unsubstantiated. But there's no follow-up. If I made the referral out on the particular family for the child, you made a referral. But nobody follow-ups on the referral to see if documents came back or information came back before you have determined whether the case is unsubstantiated or substantiated. Is a policy in place for that?
I'm going to answer that from a perspective of doing a thorough assessment, okay? I think there's so when you send out referrals for families, there's some you don't need back. Like you might tell someone, well, you could go here and they can help you with a washing machine or something that's not critical. But when you make a referral for something that is important to the case and to making a case decision, you would look at that as information you would need as the case progressed. So you would want that information back. But I just want to say social workers do a lot of referrals for a lot of things, so it would depend on which one.
Mr. Chair, this is the last. I'm really concerned about the referrals because these were not low-level referrals. These referrals were made to other medical organizations or entities, and there was no follow-up. There was no documents received back, and even though still the cases were unsubstantiated. If you make a referral as a nurse or a doctor, you make a referral, you expect something to come back to you to say what's going on. Or some policy needs to be in place. If you made the referral, you're looking for something to come back. Thank you, Mr. Chair.
Yes, ma'am. Representative Ryan, you are recognized.
Thank you, Mr. Chair. Thank you for being here today. I want to talk, Director Cauley, a little bit more about your evaluation of the Dominique Moody case and of the 122 reports and assessments, and really back to some of the patterns and find out how far this evaluation sort of drills down and what you discovered. Did your evaluation connect any dots between, are there groups of problem supervisors? Are there issues with certain social workers? Are there specific days of the week or times that, when oversight maybe was a little lax or reporting was lax? Tell me about the dots that were connected in your evaluation.
Okay. So when we looked at cases, we saw this across it was across the agency. There wasn't one particular unit. You could say it was this unit, it was that unit. And so I think that some of the work of the corrective action plan going forward is to answer those questions, to understand more about the contributory factors. And I think that Mecklenburg has been asked to look at that as they're developing the corrective action plan.
So how about when you talk about workforce, and I think you mentioned earlier something about the turnover can create less institutional knowledge. Is that?
That's correct.
Okay. So will this evaluation, the one you did or the one forthcoming, will that determine if newer social workers more likely made mistakes, or was it experienced social workers that maybe were desensitized? Are we gonna connect any dots there? Are we gonna look at that? And is there a difference between male and female social workers or supervisors? How far does that evaluation go?
So one of the things, we have worked in a large county before. You have to look at this by unit and by especially supervisors, and determine who can make decisions who can make good safety decisions, develop case decisions with integrity. So we will have to work with Mecklenburg to look at individual supervisor practice, individual program administrator practice. One of the things that I understand Mecklenburg has done is they have a contract agency that's going to come in to assist with that in addition to state oversight. So that will be a part of the go forward process. Some of when you look at this case sample, we're really just looking at what is there, what is their decision making, what do we need to focus on. So we're to the what do we need to focus on.
Last question. The county's written response to this committee states CPS history was reviewed, medical collaterals were contacted, and the child's physical condition was documented each visit. Your report to us says Child Protective Service history was not reviewed. Collaterals significant to the case, to include medical personnel, were not contacted. Is the county's characterization accurate?
I'm going to speak to what we found. And is this specific to the Dominique Moody case?
Again, the county's response, this is all public record, the county's written response to us said that CPS history was reviewed, medical collaterals were contacted, the child's physical condition was documented. Your report to us says the exact opposite. Is the county's characterization accurate?
We stand behind our review of the case, and that there were concerns about those elements of the case.
Thank you.
Dr. Reeder, you're recognized for a brief follow-up.
I promise I'll go quick. Going back to what Representative Quick was asking, in the quality assurance team, does the state, since it's county administered, state supervised, does the state have an obligation, or do they have a policy where they do audits to make sure that the counties are doing what they're supposed to do?
So we are with PathNC, we are better able to do statewide audits.
And are you doing them, is that by statute or by policy that you're doing them on all those counties right now?
That is by policy, it is not by statute.
Okay, and what does the policy say that you're doing?
You will not find this in policy. We have determined that the best way to, we have made the counties aware, the best way to look at counties statewide, and let me just say, the ability to look at counties statewide, it is there because of PathNC. Prior to that, we had a difficult time because you didn't have a window.
I understand that, but in your policy, how often do you review counties so that we know what's happened in Mecklenburg and these other counties is not going on today, that there's poor oversight from the state of the counties?
So we have 4 elements that we will look at, that we started in April looking at, and 3 of those are specific to Mecklenburg. One would be we are looking at safety plans, contacts with children, supervision, and the other is case plans.
And I'm not worried about Mecklenburg. There's 100 counties in North Carolina. Do you have a policy where you routinely audit the performance of these workers across the state?
We have a protocol that we do.
What is the number of cases that you review by county every year, every month, whatever?
I'll follow up and provide that to you.
Okay. Can you tell us that every county is reviewed on an annual basis?
Every county is reviewed on an annual basis.
Okay. Going back to the intake, the supervisor, and the assessment teams, in some counties you said it's one person. Is there a practice, a policy, a procedure that if the intake worker disagrees with the supervisor or the assessment, how does that happen? Because in this case, we know that the intake worker, and there was evidence of abuse in a number of these cases, and the supervisor screened them out. What should be, or is there a process for that intake worker or to say, I think the supervisor's made a bad decision? Can they escalate it? Is that a requirement?
That would depend from county to county. You would have counties that would have a policy or protocol for that, and you would have counties that would not.
So do you think that there should be a required policy that says if the supervisor is making a bad decision, the intake or the assessment worker should be able to go to somebody to say, we're making a bad decision, as we saw in this case?
I do. I just want to say in some counties, you have an intake worker who reports to a DSS director, so you might not have somewhere for them to go to. And I bring that up just to point out the reality of what it means to work in a state supervised county administrative system.
Should that assessment worker, if they disagree with the supervisor, can they come to the state and say, is that a requirement, or do we tell them that? Because I fear that, as you talked about, the supervisor is the linchpin. And if the supervisor is making bad decisions that we've seen in this case, how do we make sure that that doesn't get perpetuated?
Yeah. I think there's also the DSS director in most counties, and I gave you the outlier for the very small counties. So also to bring it to a DSS director, but yes, bringing it to the state could be an option.
Thank you.
Representative Quick, you're recognized for a brief follow-up.
Thank you, Mr. Chair. I wanted to ask a question of Dr. Emily. Let me preface this by letting you all know most of my professional work has been in youth development, including serving as Chief Executive Officer of the Boys and Girls Clubs in Greensboro. Used a word that stood out to me, that incurious workers. That stood out to me because that can be very, very dangerous when you have a person who's either burnt out or just is not into their job. Is there a mechanism to find out or weed out those who are incurious or burnout or just have reached a plateau in their job, and something that your studies have found that can be done about that?
It's a good question. I am working with jurisdictions, and this ties to some of the other committee questions that have come up recently, where they are taking a very data-driven approach to identifying both workers and supervisors where there are consistent patterns of not just a failure to comply with policies in terms of timeliness of visits, but also where there is an indication that the outcomes for those cases look meaningfully different than that of their peers after adjusting for caseload risk differences. Generally, there would be some kind of remediation, coaching, whatnot, but some of those people need to be counseled out as well.
And finally, I'll just make this comment. I think that all of us need to recognize that this type of work is very stressful and is very demanding on the people who do it. So sometimes the burnout doesn't come from not caring about it. Sometimes the burnout comes from caring about it too much.
There's no harder job in my mind.
Representative Cunningham, you're recognized for a brief follow-up.
Thank you, Mr. Chair. This is the opportunity for you all to talk about RAMS a little bit, which I've been very impressed with RAMS going live out in 2023 in a number of counties, and that's why I was looking at the escalation team. So tell them a little bit about the RAMS that exists and what age it covers. Thank you.
So North Carolina has a team that is through a contract with the UNC School of Medicine, and it is called the Regional Abuse Medical Specialist. They are available 24 hours, 7 days a week, and they consult with county DSS agencies. They're connected with the Beacon team, which does the child medical evaluations where children are evaluated to determine if they're abused or neglected. So they are social workers that have medical expertise. The RAMS team for children 0 to 3, there's a requirement in policy that the RAMs be consulted at intake. So there's a touch there. Also, when you safety plan, you contact the RAMs, and then when you make a case decision. So for young children who don't talk, and you said, Dr. Emily said something about being too kind. Sometimes it's difficult for young children to believe that parents would actually hurt them. And RAMs will go over what the medical evidence is in a case and help a worker put a plan in place to protect, make sure that the right case decision is made. And that's one of the ways that we have better protected small children in North Carolina.
Representative Servania, you're recognized for a brief follow-up.
Very brief. You know, you were saying that some counties have so little staff that they can't do quality assurance. You know, and sometimes also even a big county, that evaluating yourself, even in the best intentions, can be not very skewed. So is there a thought or consideration of the state to have a quality assurance team that can evaluate in between, after the supervisor, for regional approach for small counties, and then even bigger counties, to make sure that we don't have to get to escalated situations like death?
Yeah, Representative, I think it's a great idea. I think it's something we could look at. I would say just truthfully, our current resources wouldn't allow for something like that because of the number of counties we'd have to engage with there, but I think that's something we'd be happy to look at and see what additional resources would be needed for having a team like that. So happy to bring that back.
Representative Campbell, you are recognized for a brief follow-up.
This is for all three of you, or any one of you if you want. I'm going to draw on your knowledge base a little bit. Do any of you have an opinion in terms of reporting suspected abuse, or like from a hotline standpoint? Do you have an opinion of whether a centralized state hotline would be more effective and less likely to result in what we're dealing with today, or 100 separate counties? Just wanted your opinions, if you have one.
I was asked this question recently by folks in Virginia who were also considering whether they needed to move to a centralized intake. It is very hard to be able to point to direct data or research. It's not something that is studied. But I will say that in all the jurisdictions I work in, it seems abundantly clear that a centralized intake process is critical to not only how we consistently respond to concerns of abuse and neglect, which every single family deserves, but there are all sorts of other frictions and inefficiencies that are created when we leave that to individual localities.
And Dr. Campbell, I'd just add, we alluded to the study around centralization options that was included in House Bill 696. This seems like something that would be very relevant to look at that and kind of look at the pros and cons for the state of North Carolina.
I look at the benefits for workers being on call. You have to be on call in case there's a CPS assessment that comes to your county, and you have to take that call. I mean, you have to do that assessment. But you have 100 counties that have to have 100 people ready to take intakes all the time. And in smaller counties, you rotate people that take intakes. They're not the people that do Child Protective Services intake. They can be adult services. They have to be trained. They can be adult services. They can be foster care workers. So a CPS centralized intake would allow you to more thoroughly train people. And as we know, if you do a job every day, you master it and you become better and better at it, as opposed to if you just do it once a month.
Just briefly, before we close out here, you guys can go ahead and start preparing in your mind any closing statements you'd like to make. But I've got a question. In law enforcement, we have this thing people talk about all the time, qualified immunity. When you're acting in your legal capacity, you have some criminal protections. Is there anything like that in this space, in the DSS space?
Mr. Chairman, I'm not sure I'm aware of anything like that, but I'll defer to my colleagues here.
like to consult on that? Our immunity is written in the state law. We can't speak to other agencies. If there's follow-up, I'm glad to work with you on that.
Are you aware of any case where, when you're in the review process, I know you've got a long-standing history of doing these reviews. Have you guys ever made criminal referrals or seen criminal referrals come out of this for neglect on behalf of the DSS agency?
Given my time in this seat, I would not be able to speak to that statewide.
Anybody want to take a stab at it? All right. In your opinion, I'll start with you, Ms. Cauley, and I'll let all three of you answer this if you'd like. What are the areas or what are the focuses we need to be moving toward in order to improve our child welfare system?
I go back to first, I think it's come out lots of different ways. First is a strong workforce. And there's so many things that have to happen with that. Practice standards. You ask good questions about the ability to monitor counties, but counties are run by DSS directors. And if that's the system that we have to make it clear what the expectations are around quality assurance. What does the state do? What's the county expected to do? And if the county and the state are expected to do those things, they have to be funded and they have to have the resources. Really thinking about standardizing practice, what's expected. The state does a lot of that. But what is the expectation that be followed? Accountability and leadership. And when I think about the system that we have, whether we're state administered, whether we're state supervised, county administered, or state supervised, state administered, those elements have to exist. So we have to have the resources, we have to have the workforce, and we have to have the expectations.
Mr. Chairman, I would echo everything that Director Cauley said. I just would argue again that we just have to continue to also invest in technology in any way we can to help support our workers. I think one of the things that we see with the pressure on the workforce, things like path-NC or potentially predictive analytics, hopefully can give them more tools to do their job better. I think that retention piece is something that we worry about quite a bit. But just efficiencies. I mean, we want to look at efficiencies in perhaps governance model or way we deliver services. So again, I alluded to some of the work that we'll be doing coming up shortly around looking at different services that maybe would benefit from some level of centralization. I think that's an important thing for our next step. We've alluded to some of the challenges with our existing structure, and I think it behooves us to really take that study seriously and look at what we know about the challenges facing the child welfare system, especially, and what we might look at to deliver services more efficiently that also support the workforce at the same time. So thank you.
I will also lead with workforce, but with a few footnotes there. I don't think it's as simple as we need to hire more people. If we're hiring more people without the proper both training and accountability structures, it's not at all clear to me based on the facts that have been released that hiring 21 additional people in Mecklenburg County would have made any difference in Dominique's case or is the kind of systemic change that's needed. I would also note that, while I have every confidence that our training in North Carolina is adequate, one of the things that I have seen broadly across the country is that we fail to distinguish the different roles that caseworkers may play. And I do think that the investigation role and the types of workers, temperaments, training, experience that is needed to do that really hard work, going into a home and asking the right questions, getting the right information in place, following up on the collaterals is just a very, very different skill set than, frankly, many of our social work grads come out with. And I say that as a professor in a school of social work. So I think that, yes, training, but also particular training around investigations, which is so critical to everything that follows. Obviously, I think there are tremendous opportunities in terms of technology. I've obviously spoken about predictive risk modeling today, but the committee has touched upon other ways that we can make sure that that workforce is equipped with the tools that they need. All agencies are woefully behind, and so when we continue to see failures, it does beg the question, is this a workforce failure, or is this a system failure because we continue to not give them the proper tools and information that they need? And the final thing I will surface is I am a huge fan of transparency. The only time that we take a close look at our child protection systems tends to be when there is a high-profile tragedy and a dogged reporter. And I think that child protection is a core government function that deserves proper oversight and proper visibility by the public and by the community. I know that we are somewhat restrained based on federal and state laws, but there are all sorts of ways that jurisdictions are figuring out opportunities to release more information. We have our citizen review panels. I'm working with a jurisdiction where they're not only doing the random sample of cases that Director Cauley talked about, but then they're also releasing those to the public properly redacted so the community can weigh in on, were these thresholds properly applied? What services were needed? Did we do right by the child and family? So I just wanted to close with anything we can do on transparency, I think will improve the system.
Thank you. Chairman Warren, you are recognized.
Thank you, Mr. Chairman. As one of the co-chairs of the committee, I just want to thank you, Dr. Emily, Ms. Cauley, and Mr. Secretary. Thank you so much for your attendance today. I thank you for your presentations on behalf of the committee, for your succinct answers. Thank you so much. I wish you a great afternoon.
Echoing that, I'd like to thank you guys for your time and your effort on this case and coming before the committee, your professionalism, your answers. Thank you. With that, the committee will stand at ease while the Sergeant Arms rotates our presenters. And you guys, obviously, I wouldn't leave Raleigh, but you're dismissed from testimony for right now. All right, we're going to be back in session now. Let's see, we're going to be moving on to the law enforcement officers or officials from Charlotte-Mecklenburg PD and the County of Mecklenburg with Sheriff Garry McFadden and the Chief. Sheriff McFadden, you requested the opportunity for an opening statement. The floor is yours, sir.
Yes, thank you. Members of the House Oversight Committee, thank you for the opportunity to appear before you today. The Mecklenburg County Sheriff's Office shares the committee's sentiment that the death of the 6-year-old Dominique Moody should have never happened. This tragedy, heartbreaking, and other thoughts remain with everyone affected by this unimaginable loss. It is important to clarify the role and the responsibility of the Mecklenburg County Sheriff's Office, as the agency involved in this case was extremely limited. Long before I became sheriff in Mecklenburg County, almost all of Mecklenburg County is incorporated into 7 distinct municipalities which have their own law enforcement agency. To put it in another way, Mecklenburg County, most of their citizens live in Davison, Cornelius, Huntersville, Pineville, Matthews, Mint Hill, and of course the city of Charlotte. Accordingly, once again, long before I became sheriff, Mecklenburg County has ceased to function as a traditional law enforcement agency. Unlike most North Carolina sheriff's offices, Mecklenburg County does not respond to calls for services through the 911 system. In Mecklenburg County, only these 7 municipalities, police departments respond to 911 calls. Mecklenburg County Sheriff's Office do not have deputies or officers trained to investigate crimes like the municipality police agencies in the county. Mecklenburg County Sheriff's Office do not provide funding to provide these services like the other municipalities for several decades. We do not conduct child investigation welfares as well. These duties are simply not within the Mecklenburg County Sheriff's Office authority or capacity. Rather, Mecklenburg County daily responsibilities are centered on the functions unlike traditional law enforcement, which can be and is provided by Mecklenburg County 7 municipalities, police departments that no other agency is authorized to provide. These responsibilities include operating the largest detention center in the state, as well as providing courthouse security, civil process, carrying out summary judgment, eviction, sex offenders registry, and gun permitting. The most direct involvement Mecklenburg County had to this case of Dominique Moody was through a civil process. In 2020, and again most recently in 2023, Mecklenburg County deputies served domestic violence protection orders, commonly referred to as 50B orders, against Tanya McKnight at 7608 Gwynn Hill Drive. In 2022, a deputy also served a complaint of a custody violation upon Tanya McKnight on behalf of Tarion McKnight at the same address. Since December 10th, 2023, Mecklenburg County's deputies had not been at that residence. To be clear, the Mecklenburg County's deputies ever encounter a child distress or observe circumstances that rise to concern of a child's safety, we take these situations seriously and address them appropriately, intervening as necessary. As the sheriff and as someone committed to protecting the citizens of Mecklenburg County, I wish Mecklenburg County had seen Dominique's suffering or had some reason to question whether she was being properly cared for or not, or she was at risk. I wish we had been given the opportunity to intervene before this tragedy occurred, but at no point did our deputies witness or receive information that Dominique was put in any harm's way. This case is devastating, and I wish more could have been done to save this child's life. I also believe continuing collaboration communication resources focused on child safety and well-being among the various agencies across the counties are critical to preventing tragedies like this in the future. Thank you.
Thank you. And apologies, I forgot to swear you guys in. So if you guys would both stand. Raise your right hand. Do you affirm that your testimony is the truth, the whole truth, and nothing but the truth?
I do.
And specifically to you, Sheriff McFadden, do you swear the same is true to your opening statement that you just read in?
Yes, I do.
Thank you. Chief Patterson.
Thank you, Mr. Chair, and to members of this committee. Thank you for the opportunity to appear before you on behalf of the Charlotte-Mecklenburg Police Department. It is certainly my honor to represent the city of Charlotte and the men and women who serve our community proudly every single day. Since our last visit, or my last visit in Raleigh, we have been busy in Charlotte working for our community. Since our last discussion, our department is remaining focused on reducing and mitigating violent crime, also to working with our community collaboratively, and also building the morale within our organizations. These are priorities that I have set forth as the Chief of Police since being appointed in December of 2025. In April of this year, we are very proud to report that our crime numbers looked very good in Charlotte. We saw reductions in crime across the board, but that would not have been possible without our partners. I am a collaborative person. I believe in working very closely with our other law enforcement partners as well as our business community, our nonprofit community, and such. The results of the work that we have been doing comes because we are partnering with state agencies, our federal partners, and such. We had several operations that we have done to address crime and to make our communities safer, but I do want to highlight that just last week, we shared the results of our Garden Inn operation that was conducted in North Charlotte. And it was a culmination of a 6-month investigation that we did with our federal partners to include the FBI, as well as our U.S. Attorney's Office of the Western District of North Carolina. Following that investigation, sustained investigative work, including surveillance, undercover operations, and controlled purchases, we executed coordinated arrests and search warrants at the Garden Inn in the North Tryon Division. And I bring that up because at that hotel, we had children living there, residing there. We were very concerned about their well-being, and that is one of the reasons why we were looking at that location. Because of the great work of our team, 11 individuals were arrested, 5 were charged federally with drug and firearm offenses, and during the course of the investigation, significant quantities of fentanyl, cocaine, and other narcotics were seized, along with illegal firearms removed from circulation. This operation really reflects what is possible when we bring local, state, and federal partners together. At the same time as we are trying to reduce crime in our community, we are working aggressively to address the staffing challenges within CMPD. I talked to you about that the last time I was here. And I'm so grateful that our city, and with help from the state, we hope that we will see critical investments in public safety, including a 10% pay raise across the board for our police officers. We are grateful to you, this body and the General Assembly, for the Back the Blue Pay Act that you are looking at. I think that is going to help law enforcement across the state. It is a meaningful recognition to the service and the sacrifice of our law enforcement officers, and I think that it will make a great difference in recruitment and retention efforts. Now, turning to why we are here today, I will tell you that our oath is not simply to enforce the laws of this state or of our local laws, but our oath is to protect people, especially those who cannot protect themselves, our vulnerable populations. The death of 6-year-old Dominique Moody was an absolute tragedy, and no statistic, no policy, or no explanation can diminish the reality that a child is gone. A child lost her life under horrific circumstances. A family will be forever changed. A community will be left asking a lot of questions about this, and they are difficult questions. I can assure you that the men and women of CMPD, especially our Crimes Against Children unit and our Homicide unit, approach this investigation with urgency and a clear sense of responsibility. They work tirelessly to uncover the facts and follow the evidence wherever it led. That work ultimately resulted in criminal charges, including felony child abuse and murder charges against all 3 caretakers. But accountability after a tragedy does not erase the tragedy. We recognize that. Justice is essential, but justice cannot restore a life that has been lost. And so we are happy today to talk about our policies and procedures as it pertains to CMPD and how we approach this case. Thank you.
Thank you both for being here today. Thank you for those opening remarks. Same process before. Members, 5 minutes per member. Go ahead and get in the queue if you want to be in the queue. The chair is not anticipating us getting stuck anywhere today. We have Representative Campbell in the queue first.
Thank you, Mr. Chair. And I really only have one question. And before I do, Sheriff, if I heard this correctly, correct me if I'm wrong, that if there was a suspected abuse that was going to be reported to law enforcement, that would not come to the sheriff, correct?
That is correct.
Okay. So, Chief Patterson, a bit of a hypothetical, but unfortunately not. If social services has a visit to a child and there is suspicion of criminal abuse, the police force, the DA's office, I know they're not here, but I'm kind of including them on this as well, are kind of the protectors that are brought in. So if they make that assessment of suspicion for abuse and they do not bother to make the effort to notify law enforcement or the DA's office, it essentially makes your job impossible to protect those children. Is that fair to say?
So, Mr. Representative, I would say that if we do not receive information, whether it comes from the public, whether it comes from DSS or some other avenue, it does make it very difficult for us to be able to investigate or to take any corrective or criminal action against the person or the entity.
Thank you, Chief. That's all I have, Mr. Chair.
Well, I'll go ahead and take some prerogative with you guys wanting in on it. Yeah. So, Sheriff McFadden, I'm going to start with you, sir. What were some of the reasons for your visits to that residence that you annotated earlier? You referenced warrant service, correct?
Yes, and it took place in 2020 and 2023, but those were domestic violent orders against Tanya McKnight.
Okay. And those are the only two interactions you had at that residence that you're aware of, sir?
We had, with my deputies, 1, 2, 3, 4, 5, 6, 7. We had seven times we went to that residence. I think 4, they were to serve the domestic violence protective order, but no one came to the door.
Yes, sir. And so I've worn a badge. I kind of know what the process looks like. But for those of the public that don't know what a warrant service or an attempt to service for a civil action or something like, can you kind of walk through how your deputy might be on the property but not enter the house?
Right. So we're not called for 911. We usually knock on the door. Someone comes to the door, and we're telling them that we're serving them a civil process, a civil paper. At that time, there's no real need to be searching for someone unless they can see that someone's in the house or we believe there is someone in the house. But if the person comes to the door and we just said this is a civil paper, we serve them with that paper.
Oftentimes on a civil service, it's just literally the matter of just identifying them and handing them the paper, correct?
That is correct. It's literally that.
And how does that differ than, say, the service of a warrant?
Well, the warrant will give you jurisdiction, or we said the ability to go in the house to look for the person, and that's pretty much the difference. You have that legal obligation that you should be in the house looking for someone if that address is on the warrant. But usually the civil matter is just you go to the door. Sometimes they're in the yard and meet you at the door, and you provide that civil paper, and you're on your way.
And I believe your testimony indicated there were several attempts to serve that were unsuccessful. And so in that, it is oftentimes as simple as they knock on the door, no one answers, correct?
That is correct.
And so, again, they would not enter the premise.
That is correct.
Okay. And then even on the successful attempts, that doesn't indicate to you, do you have any way of knowing whether or not that successful attempt to serve the warrant happened inside the residence or just on the curtilage of the property?
Not at this time, but if the deputy provides that information to dispatch, I'm sure that is recorded.
Right. what I'm saying, though, is the information available to us only indicates that there was a successful service, not necessarily where on the property that service occurred.
That is correct.
Okay. Thank you, Sheriff. Patterson, moving on to you. What were the number of calls your agency received to that location?
Yes, sir. Since 2020, there were 59 events or associated through our computer-aided dispatch, our CAD system. And if I can, I'd just like to clarify a little bit about that.
Yeah.
That did not mean that there were 59 welfare calls to that particular residence. Actually, there were 36 incidents, if you will, and those incidents were wide in range, meaning we got a call for wreck, we got a call for forgery, stray animal calls, we did zone checks, we had larceny calls, the domestic situation between neighbors. Those were the types of calls, not just welfare calls to that residence. Was to say 59 calls, how many times did you guys actually physically respond to the residents? We responded, anytime we were called, we were responded. So those 36 incidents, we responded to those.
36? Okay. Are either of you aware of any other activity or any other attempted services at the residence that did not involve what the individual named Tanya McKnight?
I would say that we responded every time that we got a call and we went there or to that location. I'm not aware of any other time beyond that.
So there was no attempt to serve anyone else? There was no look for anyone else, a male subject at that location?
I'm sorry, Mr. Chair, can you repeat that question?
I believe that there was a criminal case in that area that there was another suspect involved in that location for a different event. Are either of you aware of that?
I would say, Mr. Chair, pursuant to the protective order.
It has nothing to do with that case.
Is it okay that I confer with
Yes,
my
ma'am.
counsel on that? So, Mr. Chair, I'm prepared now to answer that. So there were calls that did not involve the suspects.
In this
Question.
particular
Yes.
case? Are you prepared to speak on those calls?
Yes, I believe I can.
Thank you.
There was one call in which an individual was arrested at that residence.
And
It was a domestic call.
it was a domestic call?
Yes, sir.
And do you have any reason to believe that there was no access to the house at that time?
From the response of our officers, we do not believe that there was.
And is that the only incident that you're aware of?
Yes, sir.
So are there any other relatives that may have been staying in the house that were accused of a crime that either of your agencies went to that house looking for?
With our calls for service, when we investigated the case, there were 3 individuals who were arrested, and they pertain to the case. Aside from that, I'm not aware of anybody else.
We'll come back to that. I believe, Dr. Reeder, you wanted to.
Yeah, just a couple quick questions. Law enforcement, you're required reporters for child abuse, correct? If you have,
Yes, sir.
thanks for being here. If you have a suspicion, you're an obligated reporter, correct?
Yes, sir.
And so my question is, in this case, there were a number of calls, and you responded to several of those, and you had conversations with DSS. Did did your police force make referrals to DSS about this case?
Yes, sir. And I would indicate that the call that we received where a DSS referral was made was not at this location. It occurred in April of 2022. It was a call for service that we received.
Do you get follow-up routinely after you make that referral to see what happens?
Sometimes we do, sometimes we do not. It just depends, I think, on the disposition of the case. If it's going to continue on, if our investigators are going to continue to investigate it, then of course we're having communication with our other partners to include DSS. If the case is screened out and there's no further workup on the case, then there's no further communication.
And maybe in general, in this one, there was a lot of calls that you were aware of, and they were well-known family. Do you have a policy or practice, or if you feel like DSS is not making a good decision to screen in calls or screen out calls? Because we know in this case, a number of the calls were screened out. If you have suspicion.
So our leadership particularly in our Crimes Against Children unit, which investigates felony cases primarily or sexual assault cases, they would speak to the supervisors over at DSS or the other agency, any other partners, if there are suspicions, if there are questions about the response, about the timeliness, the efficiency, that kind of thing. They do have conversations with them.
What would be the typical practice if the child criminal investigating unit, which you described, if they felt like they weren't getting the adequate response from social services or from social services?
So particularly for our detectives, if they were not getting a response, that would be elevated to our supervisors, who would then communicate with the supervisors on the DSS side.
Okay, and if the supervisors on DSS that we know in this one screened out a lot of calls, what would be their next step?
We would continue either to try to communicate with them, it would be elevated to a higher level.
Okay. Do you know if in this case that any of the detectives went beyond the supervisors to try to get help for this child?
I am not aware of any.
Okay. Thank you very much.
Representative Reeder, are you done? Yep. Representative Sheetzelt, you are recognized, sir.
Thank you, Mr. Chair. Thank you both for being here again today. I believe all of my questions are likely going to be for Chief Patterson, so thank you. I believe the materials that we received said, we mentioned the 59 calls, 36 incidents related to the residents here. On none of those calls did our officers observe child abuse, child neglect, or child welfare concerns. Many involved matters entirely unrelated to domestic or family issues. Did CMPD and did any officers ever go inside the residence or have contact with any of the children during any of these calls?
Yes, sir. On one occasion, our officers did note that they saw the children and that they appeared to be in good health.
Okay. And how many of these calls were for domestic violence through that time? Do you know?
Sure. Just if I can refer to my call log. We have three calls to domestic disturbance and one call to domestic violence, physical assault.
So the notes I have say that there were, I think, 8 different calls in 2023 alone related to domestic violence. Have we miscounted that?
I think the clarification for that is there might be duplicate calls or calls where a neighbor may have called, but it's the same incident kind of thing.
Okay. We also have a number of calls for animal bites. Do you know how many of those there were?
I do not. I know that there were 2 stray animal calls that our animal control unit responded to.
Okay. And there were also just welfare checks on at the house. Is that true as well?
Yes, sir.
I guess my question is, at what point do these calls cumulatively raise a concern for CMPD that this should be referred to DSS? When does that cross the threshold?
Sure. While there's not an exact number on that, I mean, when we look at these calls, it's a span over 5 years. We did not see a pattern of behavior that was concerning in those 5 years. As we look forward, though, and as we dive into this case, one of the things that I'm looking with my team is to be able to flag calls, to have an automatic flag to say, is there a problematic issue here? Is there something that we should be looking at more? When Dr. Emily spoke about that predictive analysis, that is something that we're very interested in, and seeing if that we can get grant money to be able to implement something of that nature.
Yeah, I agree. The predictive modeling would be helpful. And the unfortunate, I think the unfortunate side of what we heard earlier is that that's dependent on the inputs, garbage in, garbage out. So we have to make sure that DSS is getting adequate inputs. And so I guess my questions here, and this isn't really a question, just more of a thought, is my concern is, at what point do we give DSS the inputs, and what is DSS doing with those inputs? That's, I guess, what we're here to try and sort through today. I believe we mentioned earlier that there was one referral made to DSS that was not related to the residents, that something was observed elsewhere. And did you ever hear back from DSS? I don't know if you answered this earlier, I may have missed it, but did you ever hear back from DSS regarding that report?
Not that I'm aware of. We did make the DSS referral on that, and I do not believe that we got a response back.
Okay, and is it standard operating procedure for CMPD to continue communications with DSS after, not necessarily this incident, obviously you said you never heard back, but is it standard for CMPD and DSS to continue communication after a report is made?
Typically, if there is a criminal investigation that comes out of the referral or the communication, then certainly we will continue to communicate with them. But again, if the case is screened out, then typically we would not hear back from them.
Thank you very much. Nothing further, Mr. Chair.
Representative Cervani, you're recognized.
Thank you, Chair. A question for Chief and Sheriff, actually, whoever can answer this. First off, I share the remorse and condolences to the family. I share your thoughts when it comes to Dominique Moody. I do want to ask, Chief Patterson, you had expressed that there had been one time that the 3 associated adults of that residence were arrested. At the time, did the young children in that home have another identified parental or guardian of that time? And if not, what is the procedure in which, if all the adults of that residence are arrested, is DSS notified, and are they taken for placement?
Yes, ma'am. In that instance, if any child welfare call, where a child is in danger, where we perceive that there is something that could be harmful to that child, we can make a take temporary custody of that child. We certainly have the right to do that, and we have done that in different instances across the board. Anytime a child is in danger, we would do that, and we certainly would do the full investigation. Going back to you asking about the 3 arrests, so those were post the death of Ms. Moody, where we made those arrests of those individuals. And at that time, the other children were taken out the home.
Representative Quick, you are recognized, sir.
Thank you, Mr. Chair, and again, thank you all for being here and welcome. I just have one question. I asked, and I wish I had done it online, but I asked offline the previous guests who were here about special needs children and investigating crimes that involve special needs children, where either the child is either a victim or a witness to a crime, or a victim or witness to abuse in the home. What methodologies does each of your agency use to get information from special needs children, that it could include nonverbal children, or from children who are hesitant to speak out because of fear?
In those instances, our Crimes Against Children team, they are skilled, they are trained, they get special training in how to do those interviews, but often, most of the times, we rely on taking them to our Child Advocacy Center, where we have individuals who are specially trained in doing those forensic interviews, particularly with those children who have special needs. So if our detectives are able to handle those investigations and those interviews, they will do them, but most typically, we rely on our partners for that.
Although we do not answer the 911 calls, but of course my deputies do interact with the public on a day-to-day basis, and we are required by law, and I think everybody should know that with the North Carolina General Statute 7B 301, we are required by law to report that immediately to DSS or Protective Services, and need be, we will get in touch with our local law enforcement agencies, any of the 7 in Mecklenburg County. And if we have a language barrier, as you say, we would have the resources, hopefully in each county, to remove that barrier, whatever means are necessary.
Thank you. Representative Cunningham, you are recognized.
Thank you, Mr. Chair. So I want to go back to the requirement for you to report. If you went to the residence, and this is for both of you, Sheriff and Chief Patterson, if your officers or your deputies went to the residence, and from what we were able to see, what was reported and documented of how the residence looked from the outside, and if your people were able to enter and saw the conditions on the inside, how many times did you all make a report to DSS? How many times did your officers make a referral? Did yours make any, Sheriff McFadden, to DSS?
No, we did not.
So, let me follow up. So they went there. Did they ever go inside of the home, or they only stood at the door?
We don't have any indication that they went inside the home.
Thank you. Chief Patterson.
Yes, Representative Cunningham, as stated, there was one referral that we made, and it was not at the premises. It was not at the home of this residence.
So, but your officers went to the location.
Yes, ma'am.
They saw the outside, whether they got inside, and I'm assuming that some of them did get inside. Were there not just one referral from 59 times that they went to the location and they saw nothing that indicated there was an issue?
There was one occasion, as stated, where there was a DSS referral. One outside of this location and one at the location.
I'm done.
Representative Ryan, you are recognized.
Thank you, Mr. Chairman. Sheriff McFadden and Chief Patterson, this question really is probably for both of you. Sheriff McFadden, you told us in your opening statement what you and your department are not responsible for, and I appreciate that information. You stated you had limited involvement in this case. You also stated that we need to look to figure out how to prevent future tragedies. What I have found in complicated cases like these involving different people, different departments, is that best practice, good leadership, is to get people around the table and figure out not what we didn't do, but maybe what ownership we can take in this. What piece do I take in this? Instead of pointing fingers or this wasn't my fault. So for both of you, I'm asking, what ownership do you take? What ownership do you or your department take in this tragedy, the system's failure of Dominique Moody? Which piece of it do you take, if any? Which areas of improvement do you have? What ownership do you take in the system's failure of Dominique Moody?
So I would say from a CMPD perspective, as we have been looking at this case, delving into it further, I think we need to have more communication, definitely with our DSS partners. I think that we could do more thorough investigations when we look at these kinds of cases. As everybody has stated, this is a tragedy. If it could have been prevented, we should have done everything we could in our power to do that. Looking forward at some things that we can do to better, or to look at ways to minimize things like this. We've looked hard at our body-worn camera reviews, having a system in place where we get an automatic report every single day of any case, any call involving children, no matter what it is, to be able to look at it more closely to see if there are patterns and trends and that kind of thing. And this would be a supervisory review of the body-worn camera. Also to our umbrella center that's going to go online next year. That is going to be a location where our victims have resources. It will all be under one roof. Our detectives can talk to DSS representatives. We can talk to other partners. Sheriff's office will be at the table. Everybody is there to talk about the cases. And while I know these are things we're talking about for the future, it doesn't change what happened. I think there isn't, you asked me what do we hold, or what's the responsibility that we have. I think moving forward, this is where we have to communicate more and make sure that we're doing thorough investigations.
Thank you for the question, but I think we first have to have knowledge of something before we take the ownership of it. We did not have knowledge of any of this occurring, and as I said before, I wish we had the opportunity to help this young lady, but we didn't have any knowledge. We didn't have anything about this young lady with our visits to the residence. I looked at our list. We had 7 contacts to that residence. 4 was unsuccessful, and 3 we did make contacts. But again, we are limited at what we were doing with that. At no time that we saw that this young lady was involved in any of our contacts at that residence.
So just to clarify, Chief Patterson, you have identified some things that you're working on or going to work on in your department.
Yes, ma'am.
Sheriff McFadden, of the entire system and that failure, you don't take any piece of that.
No, we will take that. We're going to, I think, as of this past month, we take ownership of allowing our deputies to know that you need to be mindful, more mindful, and we sent out a memo stressing the importance of that, to be more vigilant.
Can you clarify what more mindful means?
Take that next step. Look around the house. Maybe, as we say, we never went inside the house, but we had no knowledge of this young lady. But maybe say that the conditions outside the house, or conditions that when you open the door, may be reportable to DSS or to the outlying agencies.
Thank you.
Representative Sheets, you're recognized for follow-up.
Thank you, Mr. Chair. Chief Patterson, I just want to follow up briefly and clarify your response to one of Representative Cunningham's questions, because what I heard, and you correct me if I'm wrong or correct me if this was misstated, but earlier when we were discussing it, there was one referral, one report made to DSS that was not at the residence. There was one contact with the children at the residence in which, according to the officer who made that contact, there was nothing concerning that would require a report. But what I heard you say to Representative Cunningham was that there were 2 reports made, one at the residence and one away from the residence. Can you clarify that for me?
Yes, sir, and thank you for that. I did misspeak on that. We had the one outside of the residence, and then we had the welfare check where our officers did go and talk to the children, looked at the children, and did not report anything unusual or anything that was neglectful.
Okay, and since we've been talking about communication, we've been talking about CMPD making referrals to DSS. I want to ask if there was ever a point where DSS made a criminal referral to CMPD regarding the individuals at this household.
May I confer with my attorney just one second on that?
before you respond, I also want to clarify my question. Before Dominique Moody's death, were there ever any criminal referrals made by DSS regarding any of the individuals in the home?
Yes, so there was one in 2024. However, there was no finding of any criminal activity from that or any abuse from that.
And so did the authorities enter the home at that point? Did anybody go to the home and investigate that?
No, there was not, because it was screened out by DSS.
So DSS made the criminal referral, but then screened out?
So our Crimes Against Children's unit received that referral, and we then referred DSS to take a look at it more closely, to do a visit to the home, and at that time it was screened out.
So this sounds like the power outlet's plugged into itself. DSS makes the criminal referral, and then CMPD takes that referral and refers it back to DSS. Is that what I'm hearing correctly?
So there was no, and I know that it sounds complicated, and I'm really trying to do my best to navigate.
It sounds circular.
Yes, sir. Yes, sir. And so when our Crimes Against Children unit received that referral, they looked at everything in it, and there was nothing that would indicate necessarily a criminal offense. And so our detectives then referred it to DSS to do a home visit, and then it was screened out at that point.
Okay, just a quick comment, Mr. Chair. The public reporting on this, there's a lot discussing the home's condition. Even just from the exterior, there were holes in the roof, there were holes in the wall that led from the inside to the outside. These sorts of things, if they did lead to the outside, should have been observable from the outside. I'm going to confess a little mounting frustration today as we've had these discussions, that there seems to be a lot of willingness to shirk responsibility and to try to place the blame on someone else or circle the wagons and say, hey, we don't accept any responsibility for this. DHHS didn't accept responsibility for this. Our law enforcement agencies are, trying to say, hey, we only went to the house, or we didn't observe anything. There were flashing red signs that should have tipped people off that something was not right here. And I know every time we come into Oversight, I always seem to get on a soapbox about public trust and confidence in our government and in our government institutions. This sort of bureaucratic morass over accountability is why people don't have trust in government institutions. This is why people have a hard time believing anything anyone says when it comes out of a government official's mouth. At some point, there are a lot of people who need to accept at least some modicum of responsibility for what happened to this 6-year-old girl. Most of us don't wake up one day. It is not a common experience to find a dead 6-year-old child in a dog crate in a home. There's a lot that fell through the cracks here. This passed through a lot of people's hands, and a lot of people need to accept responsibility for this. With that, Mr. Chair, I yield whatever time I have left.
Thank you. Chief Patterson,
Yes, sir.
you made reference earlier to there was a quote, a visit from your officers that at some point your quote was they appeared to be in good health. When was that visit?
That was in April of 2023.
In April of 2023.
Yes, sir.
Okay. I'm just going to write that down.
I'm sorry, Mr. Chair, that would be March of 2023. March 29th.
Okay. And then in another line of testimony, I forget, it might have been Representative Cervagna's line of questioning. I think you said that if it could have been avoided, referencing the Dominique Moody case, so is it your testimony that that death is unavoidable?
It's my testimony that I believe that collectively there could have been done more in this case to save her life or to have a different outcome. Anytime a person is killed, murdered, shot, whatever the case may be, we're always looking to see what could have been done better. Certainly, as I stated, I think there could have been more communication. There could be more thorough investigations on all sides to potentially prevent something like this from happening.
I just wanted to be very clear for the record that you, in fact, your testimony is that you believe that this was avoidable.
I believe it could have been, yes.
Could have been, yes. Okay, thank you. I just want to back up because my brain operates in a strange way. I remember things. I can't remember why I remember them. But I want to come back to the line of questioning that I had with you guys about anyone else or any other engagement in that property, and give you guys a chance to double down on the testimony that there was no other involvement for no other suspects at that house that are not involved in the criminal prosecution for the death of Dominique Moody.
So, Mr. Chair, I will say that there was an arrest, and thank you for clarifying that. There was an arrest of an individual in that residence that occurred. Not one of our suspects, the three suspects that I indicated, but another individual that was hiding out in that residence.
Okay. You'd like to clarify on that? Because if it's the individual I'm thinking of, that's a closed case, so that's not protected by anything.
Yes, Mr. Taryn McKnight Jr.
Okay. And what was he sought for?
For murder.
What was he ultimately convicted of?
I don't have the conviction. I believe it was for murder, but I do not have that information. I can get it.
Was there also a robbery with a dangerous weapon charge?
Possibly. I can get that information for you.
And what other interactions with that individual associated with that property did your department have? If you don't have that prepared for us right now, I understand.
I do not.
Yeah, so that's the only interaction that your department had.
As I understand it, yes, sir.
Okay. And what day was he, what was the date again that he was arrested?
He was arrested, let me. Okay. May of 2024, and he is still in custody.
Yeah. Okay. Is this one of the times that you're referencing that your department made a referral to DSS?
No, sir.
So you've already said that you guys were inside the house.
Mm-hmm.
Why? I've seen pictures of the inside of the house.
We made when we did the welfare check, that was on March 29. That's when our officers saw the children, and they appeared to be in good health at that time. The rest was made afterwards.
I struggle with that description of events, not saying that you are not giving me the most honest testimony you can with what you know. I'm not insinuating that in any way. I know what I know, which we will get to some of that later, and it conflicts with the facts as you know them. And I struggle reconciling those in my mind. Also, which agency actually executed the arrest?
CMPD.
CMPD executed the arrest? Okay. So did your agency, Sheriff, attempt this service, or was it just handed off to CMPD?
It was probably handed off to CMPD. The only time that we had a Terry, the gentleman we're speaking about, we had a service of a summons on 7/6/2022. That's the only time that we had that individual named in any of the paperwork that we had.
Thank you, Sheriff. With the referrals, and we keep going back to the term, the children were in good health. As far as your understanding of basic training, policy, and procedure, should a referral be made if the living quarters are full of animal feces. There's holes in the walls, holes in the floor. There are rats in plain sight, roaches in plain sight. Should a referral to DSS be made in those circumstances?
I would say if we're at a residence and we're seeing anything that would show that a child needed medical care, where the environment is injurious to the child in any way, then yes, a referral should be made. There could be criminal charges as a result of that, yes.
I've been involved in warrant services myself. I understand. We talked about very basic warrant services earlier, Sheriff. I think you guys would agree when you are looking for a first-degree murder suspect that is also part of an armed robbery, that's carried out in a different fashion, would it not be, Sheriff?
That is correct. It would be. That is correct. It would be.
Significantly more aggressive? Is that an appropriate description of the way law enforcement would handle that investigation and that execution of the search warrant?
Yes.
Would proper protocol and procedure, would it be reasonable to suspect that every room was searched and every room was cleared of a threat in that scenario?
Yes.
Yes, sir.
And nothing was observed? That's the apologies, Sheriff. I just transferred and didn't acknowledge. I'm sorry. And as far as you are aware, nothing was observed, and the children were in good health. That's the reports that you have.
What the officer shared, it appeared that the children were in good health. And I will address what you're saying, Mr. Chair, because I've been on search warrants before. We go to many homes where the home is in disarray, where there are perhaps insects and different things in a home. If it's to the point where it's injurious to the individuals living there, if there are children that are harmed in any way or potentially harmed in any way, we do a referral, or we should do a referral. That is our practice. That is our policy. We also have what's called a CDCP, which is a child development community policing clinicians. These are social workers that when we do go to calls and we see those kinds of things, we do a referral to them. They come in, speak with the families, and they provide resources to that family if they need it.
In 2024, body cameras are abundant now. In 2024, was it common practice or policy for your tactical officers to wear body cameras to document their takedowns and their execution of search warrants?
Yes, sir.
And while I'm sure all that footage is probably part of, would I be safe to assume that all that footage is probably part of the criminal case that?
Yes, sir.
Okay. That saves us a lot of back and forth. I think that's all I have for now. Is there anyone else who wants to follow up? Representative Cunningham, you're recognized for a follow-up.
Thank you, Mr. Chair, and this is to both of you, Chief Patterson and Sheriff McFadden. I'm very concerned that the interactions took place between CMPD officers and that your people were also, Sheriff McFadden, in that vicinity at the residence. And it was almost like we had a shield over our eyes and we could not see. And that cannot be. I'm a nurse by profession with over 30 plus years and have dealt with children that have been abused. But to go to a site and not see what was on outside in the yard and then go inside of the house and see the conditions. And there were 5 children there living within that quarters, and only one referral was made. So we are all responsible. You're not responsible alone. You're not. A lot of people close their eyes and fail to see. And I know it's hard, but that's what we are expected to do to protect the children in this entire state, is to keep our eyes open, observe and assess and report to the necessity for that child to survive. And we have failed. We have failed. Thank you, Mr. Chair.
My pleasure. All right, so again, Chief Patterson, Sheriff McFadden, I appreciate you guys coming before the committee. It's a pretty heavy case, but appreciate your efforts in here and attempting to answer our questions, given the limited nature of what you're allowed to share and even in your case, Sheriff, the involvement in the case. So thank you guys. And again, I reserve the right to call you guys back, so I wouldn't drive back to Charlotte just yet. But feel free to enjoy the beautiful scenery of Raleigh. So thank you. And we're going to stand at ease just for a moment so we can switch out our presenters again. Thank you.
Thank you.
you.